All right, it's 8:30. Please stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. This morning, as we join in this meeting, I have a scripture to share with you, Jeremiah 29:11, and it says this: "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future." So as we bow our heads, Father, as we come to you today, we just ask for your blessing on this county and on our citizens, and as we battle the battle of the pandemic. Father, we ask for healing, for wisdom. We just ask for guidance. And Father, as we conduct today's county business, we ask that you be with us, guide us, direct us, and we give you thanks for that today in Jesus' name. Amen.
Amen. First of all, I welcome all of in attendance today in our meeting. We have a full house. It's good to see. Tomorrow is our election day, and if you have not already pre-voted, I highly encourage you to vote tomorrow. I know I'm talking to the choir here today because I'm sure every one of you have voted or will vote. We need to keep our clerk quite busy with her election stuff, and she has been, and doing a fantastic job.
Thank you.
Fantastic job. On our agenda today, gentlemen, we need to add an executive session at the very end for non-elected personnel. And then for our consent agenda, we need to remove the approval of minutes, as our election clerk has been rather busy and has asked to exclude that for our.
So moved, Mr. Chairman.
Okay. All those in favor of the agenda signify by saying aye.
Aye.
The consent agenda now then, gentlemen.
Mr. Chairman, with the minutes being removed from that agenda item, I would move that we approve the consent agenda.
And I'll second, Mr. Chairman.
Thank you. All in favor signify by saying aye.
Aye.
Aye. Motion is carried. Public comment. I'm quite sure we have a few voices we wouldn't have this full room. I will lay out some ground rules right off the start. We absolutely must be done by 9:15. We have a scheduled Zoom. So I will limit speaking to 5 minutes apiece, because I assume there's going to be, well, it gives 1, 2, 3, 4, about 8 of you. So pick your 8. Who would like to start public comment?
I'll start.
Please state your name for the record for the clerk, please.
My name is Dr. Gretchen Dunford. I no longer work here in the capacity of a general surgeon, but I still live here. I graduated from high school from this community in 2002. I completed my surgical residency in Detroit, Michigan, and came directly back here and have been here for the last 4 years. In a recent op-ed published by the New England Journal of Medicine, all editors of the publication signed an article that stated our leaders have failed the test of leadership. They have taken a crisis and turned it into a tragedy. The Johns Hopkins Center for Systems Science and Engineering shows us that the U.S. leads the world in COVID-19 cases and in deaths due to the disease. They point out numerous steps where we have failed. 1, we had ample warning, but couldn't test or provide PPE. 2, our leaders have chosen to ignore experts. 3, people who are traditionally disenfranchised have been hit the hardest, making issues surrounding inequality even more prevalent. 4, our leadership takes pride in the economy, but the truth is that disease rates remain so high in certain areas that many businesses are still not able to reopen fully. Others here today will be giving you examples of all these points, but I'll be focusing on the last. Mr. Drees and I had a conversation this weekend, and one of the things he said to me is you doctors don't have to worry about the economy. On one hand, you may have a point because we as physicians consider human life to be invaluable. On the other hand, I would ask you to consider that if wellness of people is not important to an economy, then why do employers pay for health insurance? I would also ask what good is an employee who has to miss work for 2 weeks to the economic success of their business or the business that they work for? Examples of how high infection rates have hurt our local economy is loss of staffing at the hospital, which directly affects your ability to admit patients. Loss of time and staffing at the health department, which directly affects the timely manner in which a community member can receive a test and therefore return to work. And also other businesses like Wendy's, for example, who continues to have limited hours and drive-through services only. And it was confirmed with their manager on duty yesterday that their short staffing situation is in fact a direct result of high infection rates in this community. All of this has a compounding impact on our local economy. Some of us here, we as representatives of healthcare in Finney County, are before you today asking for a mask mandate. I realize that we have reached a point where there is so much animosity towards that word that it will surely spawn dissent, but it shouldn't. They are a public health tool that has been shown to slow the spread of illness. A study from the University of Kansas that was released just last week clearly shows the slowing of infection rates in counties in Kansas with a mask mandate versus those that do not. After speaking with a few of you individually, it seems that you in fact agree with the efficacy of masks and social distancing, at least this is what you have told me. We elected you to make hard decisions for the welfare of our county and its citizens. I came home to care for you, and so now I'm asking you one last time that you strive to make our memories of this town something of success and solidarity, and not complete and utter failure in our response to COVID-19 as infection rates continue to climb and, among other things, affect the economy of our county in a negative way. No one envies your position. Leadership is a heavy burden to bear. There is no decision that you make that will make everyone happy, but there is only one decision to be made that will better ensure the health and productivity of our county. Be leaders outside of the vacuum of leadership that our nation has fallen victim to. I am asking you to be the example of a growth mindset and to do what's best for the health of yourselves and the health of your constituents. Thank you.
Thank you very much, Doctor.
Thank you.
Hello, Commissioners. My name is Dr. Rachel Swati. I'm a family medicine physician at Plaza Medical here in Garden City. I'm here today to discuss with you the state of COVID-19 in our community and the dire need for more measures, and specifically, at least a community-wide mask mandate to help slow the spread of COVID-19. I'm also here today because as a physician and as a Christian who believes that each and every life is important, I love and care about the people of this community and their well-being. In the past month, we have seen the case numbers in Finney County increase dramatically from 2,169 cases reported by the Finney County Health Department on September 30th to 3,105 cases on October 30th, which is an increase of 936 cases in the past month. It means that 30% of the cases that we have had in this county for the entire pandemic have occurred in the month of October. On October 30th, we also had 653 active cases, up from 197 on September 30th, a 3 times increase. We've had 20 deaths in this county during the pandemic. 8 of those have been reported in the past month. What is even more troubling is that on many occasions in the past 2 weeks, our hospital ICU has been full or near full. Unfortunately, our hospital is not alone in this. In the past couple weeks, ICUs across the state of Kansas, including those in Hays, Liberal, Wichita, and even Kansas City, have also been full or near full. As COVID-19 case numbers increase, we typically expect hospitalizations to increase even further 1 to 2 weeks later. Hospital systems in some other states, such as Utah, have already begun to create criteria on how to ration care in the scenario that they do not have enough hospital or ICU beds available. Kansas does not appear to be far behind them in our numbers. I don't know about you, but the thought of any doctor having to decide who receives care and who does not makes me sick to my stomach. Doctors, nurses, and respiratory therapists, as well as healthcare workers across the board, are doing everything they can to provide the best possible care to patients. But the fact of the matter is that there are just not enough of them to keep up with the cases that we have. In light of this, we need to do more as a community. A recent KU study that Dr. Dunford referenced from October 25th looked at COVID-19 cases in Kansas counties that adopted the governor's mask mandate on July 3rd versus those who did not. Counties with a mask mandate showed a decrease in cases 14 days after the mandate was placed. Case rates in counties with a mask mandate have held steady, while those who do not have a mask mandate have increased steadily. Overall, it was shown that counties with a mask mandate have a 50% reduction in spread. Keep in mind that this is Kansas data. This is about us, and it shows that mask mandates do make a difference. I would like to address a couple additional concerns. In addition to the minimum of creating a countywide mask mandate, we also likely need limitations in the size of social and other gatherings in our community in the coming weeks. Recently, in an article published by HPPR on October 30th, Mr. Dries stated that he felt it would be unlikely for recent immigrants to follow social distancing and gathering limit guidelines, essentially using this as one of his reasons not to put them into place in our community. In the 3 years that I've lived in Garden City, I've had the opportunity to teach English lessons to a couple different refugee families. I've also had many other refugees who I've been able to become really good friends with during that time frame. I know the refugee community well. To make a blanket statement that the immigrant population in our community would not be able to follow community mandates or guidelines is misguided at best and simply passing the buck. I'd like to close by giving you a couple of my recent patient case scenarios to consider. Prior to speaking with you this morning, I was rounding on a pregnant patient in her 20s who was hospitalized because she was requiring oxygen due to COVID-19. On Friday, I saw a woman in clinic in her 50s who was very ill after developing pneumonia due to COVID-19 30 days after her initial diagnosis. I have a third patient who is a woman in her 40s who was recently admitted to the hospital for 18 days and spent 12 days on a ventilator and now is recovering in rehab. These are just cases from the last 4 to 5 days. I'm thankful that we had hospital beds available for the 2 of those patients that needed them. I want our hospital to continue to have enough beds and staff available to care for all patients who need hospital care. In order to make that happen, we have to do more as a community. Kansans have always been known for coming together to help one another out when in need. As a physician and healthcare worker, I'm here today asking for your help as we care for this community amidst the pandemic. Thank you for your time. I actually have a copy of that KU study for each of you if you're interested.
If you would give it to the clerk, please. Thank you, Doctor.
My name is Jida Fry. I'm a physician assistant at Genesis Family Health. I'm presenting these comments of my own accord and not on behalf of my employer. I'm here to support a county mask mandate out of concern not only as a healthcare provider, but also as a mother and a daughter to aging parents. I reached my breaking point on Friday. I contacted Dr. Lindsay Burns due to her overwhelming positivity rate of 50% that morning. This concerned me for multiple reasons. I worry about the increased hospitalizations and deaths, along with further spread of the virus in the community. I was also recently made aware that our clinic cases at Genesis have been delayed in being added to the daily cases reported by the Petty County Health Department. I fear the numbers that are getting presented to the County Commission and School District do not always give a completely accurate, up-to-date representation of current cases and positivity rates. At Genesis Family Health, we have been overwhelmed with the recent increase in cases. We are currently testing anywhere from 60 to 80 people daily, and we are not equipped for that level of need on a consistent basis. First, our phone system was not set up for this volume of calls. Other staff members and I continually get texts from friends, family, and colleagues saying they have tried calling multiple times and either get no answer or the voicemail is full. This is not out of a lack of trying on our part, but we are understaffed for scheduling and testing of this magnitude. My worry is how many people try calling and then give up and skip either testing or quarantine, which further contributes to community spread. Multiple staff members are chipping in to help with testing, but even then, we still don't have the manpower to get into the appropriate counseling or contact tracing for our positive cases. The other unfortunate problem with our phone lines being flooded is that our established patients cannot schedule their routine appointments, so they are suffering as well. They are not receiving the quality of care that they were prior to us performing increased community testing, and many of our patients are not scheduling due to concerns of contracting COVID-19 when they come to the clinic. Every day, we are putting ourselves as providers in danger since it's impossible to prevent all cases of COVID from coming through the door. If we as providers get sick, there is an increased stress on the community due to decreased healthcare access. If masks were required in every public place, this would help slow the spread of cases in our community, which would decrease our burden at Genesis Family Health, thus making our efforts much more effective in caring and protecting our at-risk patients. I ask you to please support this effort. Thank you.
Thank you very much, Jennifer.
I'm here today as a private citizen.
Excuse me, could you give your name for the clerk, please?
Oh, that's Robert speaking. I also have some surveys here, and there's 2 independent surveys that find at least 9% of Kansas in no mandate counties wear a mask in public settings, and there's also in July the New York Times surveyed 250,000 residents in all U.S. counties about their respective mask wearing. They asked Kansans how diligently they wore a mask. Respondents were recorded as always, frequently, and sometimes, rarely, and never. At nearly the same time, Governor Kelly signed a mask mandate, with 80 Kansas county governments opting out of the Kansas Policy Institute. And they pulled the survey respondents and aggregated them for mandate versus non-mandate counties. Kansas Policy Institute recorded and aggregated mask wearing responses for Kansas mandate counties, and Kansas non-mandate counties. Across the state, 52% of the Kansas residents always wear masks, and 43% of residents in non-mandate counties always wear a mask, compared to 57% of the residents in mandate counties. Basically, across the entire state, mask wearing is about 93%, 95% versus 95% of the residents in mandate. So basically, I'm saying that even though there is no mandates in these towns, people are still wearing masks. I feel that asking for a mandate takes away our rights. I choose not to wear a mask because I've already had COVID. And actually, I do also work at the hospital. I got it from a patient. I have 2 other coworkers that I work with in my department that also got it from a patient. We wear a mask 12 hours a day. How did we get it? Who knows? But it's still a right of the citizens to not have a mandate. I've gone to Leota this weekend, went into the grocery store. Every single one of those people were wearing masks. I went Friday to Dillon's. I would say out of possible, I'm just throwing a figure, I think there was probably 50 people in the store, maybe 2 were not wearing a mask. I say that we are already wearing masks. I just ask that you consider not mandating it, because mandating it is just the start of taking our rights away. Thank you for your time. I also have a copy of the...
Thank you very much for your comments. I had a note passed amongst the commissioners that we ask questions, and we will not. We have on our agenda, we have a report from the health department. That is when we will discuss your comments. So, sir.
Hello, my name is Andy Plummer. I'm the interim CEO of St. Catherine Hospital, a Centura Health Facility. And good morning.
Good morning.
So I just wanted to, I'm not gonna ask for a mask mandate. I'm gonna let you know that the hospital is stressed. We have a mask mandate in all of our facilities. Yet when our associates walk out of the facility, they're going into an environment that is not safe. They come to me every day begging that we do something different in Finney County. Not asking for a mask mandate, but what we're doing currently is not working. The COVID positive rates are escalating out of control. And that is very concerning. St. Catherine Hospital is the sole community provider for almost 2.5 hours around. We're the only ICU. Our staffing is getting stressed. And I have many associates out with COVID positive or have been in contact with someone who was COVID positive. Most of the contact tracing is showing that they're getting COVID positive from out in the community, not in the hospital. I'm just asking that you all consider looking at the measures you currently have in place and seeing what more can be done. One thing St. Catherine is going to do is we're going to do a massive education campaign encouraging the 3 W's: wearing masks, washing your hands, and watching your distance. And if you have any questions for me, I also have with me Barbara Willis, our Chief Nursing Officer, and Michael Groh, our Infection Prevention Manager. And I also appreciate many of my colleagues being here and physicians and providers. Again, I just want to ask that we consider doing something different because what we're doing now in the community is not working. Thank you.
Before you leave, you have 3 minutes left. I will open the commission to you, sir, since you're the head of the hospital. Commissioners, questions?
Do you still have staffing from Colorado?
We do. We have nurses, respiratory therapists, hospitalist physicians, and hospitalist APPs. And for those that don't know what a hospitalist is, that's an inpatient physician or mid-level that takes care of the patients in the hospital inpatient beds.
And I assume you're doing testing of folks coming in for
I'm sorry, I'm Barbara Willis, the Chief Nursing Officer. I just wanted to add, the nurses from Colorado are being pulled back to Colorado because of their need there. So we won't have them for very much longer. In fact, we've been asked to relinquish them, and I've asked for another week.
We've also been told that because of COVID increasing in Colorado, they're going to have to pull back the hospitalists and hospitalist APPs. And now I'm going to have to go to the expense of locums providers, which are 3 times the cost.
presumably you're doing testing on folks coming in for elective procedures. Do you know what the rate is of positivity? Since I assume most of those people are not symptomatic, they're just being tested.
Everyone is being tested pre-procedure. I do not know that rate, but I can get it for you.
Thank you.
My question is for the doctors.
Thank you very much, sir.
Thank you. Appreciate the opportunity.
Good morning, Steve Carlin, Superintendent of Schools for USD 457. Thank you for the opportunity to speak with you this morning. In response to the COVID-19 pandemic, this summer over 200 stakeholders participated in the development of our district's COVID-19 response plan. Our plan provided an option for families to choose between on-site, face-to-face, online or blended learning, full or mostly. And approximately 1,100 of our 7,300 students, families, chose the online or blended, about 15%. Our goal all along has been to have students in school face-to-face as normally as possible while taking reasonable steps to keep our students and staff safe. The on-site option of our plan has 7 levels of increasing restrictions, 1 through 6. I'll explain that here in a minute. 1 is completely back to normal, like the way we operated before any of this started. Level 6 is fully remote. Level 5 is a hybrid where kids come every other day, so we cut the number of students in school down. And level 3.5 is the 7th level. It was added about a month ago. The district is pleased that due to efforts of dedicated staff, we've been able to conduct 9 weeks of face-to-face school. Every job in our district has been impacted by COVID. Teachers, bus drivers, nutrition staff, administrators, nurses, custodians, and everybody else has had to change the way they do their job in order to accommodate what's necessary to keep kids in school. Masks have been required for all student, staff, and visitors since the school year began. For the most part, mask compliance in our schools has been very good. Social distancing, good hygiene practices, and other strategies are also included in our plan and have contributed, I believe, to the successful start of our school year. Also at school, we believe transmission of COVID has been minimal. Most of our cases are originating outside of school. And we know that through our work with the health department and the contact tracing that they do. I would take this opportunity to make that note. The Finney County Health Department has been an excellent partner from our early conversations in March to the development of our plan throughout the summer and through the ongoing monitoring and meeting multiple times per week. And I believe many of our health services staff are probably communicating daily with the staff at Finney County Health. In the school district, we currently have 104 staff members who have tested positive and 84 students who have tested positive. We're grateful that the danger to students, both in terms of the number of positive cases and the fact that they appear to have a milder experience with the disease. However, the impact on the adults at school is becoming very concerning. We need adults in order for the school system to provide the services to students, not only teachers and paras, but those bus drivers, nutrition staff, administrators, nurses, custodians, again, all of the employees in the district play a critical part. Because the majority of the positive cases we see at school don't trace the spread back to school, it would seem that increasing cases at school are a function of the spread in the community. I'm here today because the situation in our community does not look like it did in late August or early September when we began the school year. The COVID numbers are reaching concerning levels, and I alerted our community through a letter on Friday that if the situation doesn't improve, it will not be possible to keep kids in school face-to-face after November 9th. Which would mean we would go to either our level 5 hybrid or our level 6 remote, should things not begin to show improvement. I want to share a little data. I think the people before me have probably done a better job than I will, but according to data from our district, Finney County Health, KDHE, Johns Hopkins, and the U.S. Census, 2.72% of the United States population has tested positive for COVID. 1.23% of Kansas residents have tested positive. 8.43% of Finney County residents have tested positive. And in our district, 7.59% of USD 457 staff have tested positive. In our community, the weekly case numbers have been mentioned. I won't repeat those. The positivity rate of testing has fluctuated throughout the weeks we've been monitoring that with Finney County Health. But over the last 3 to 4 weeks, we have shown us a trend of dramatically increasing numbers. The hospital shared information. We've heard the same kind of information from the hospital about stress on the hospital in terms of ICUs, in terms of their number of COVID patients, and the stress that puts on the community. And again, in our district, 75 of the 104 positive staff members have occurred in the last 4 weeks. Substitute fill rates are also a problem for us, like they are for districts all across the country and the rest of the state. Right now, we're filling somewhere between 35 and 55% of our substitute requests. That puts stress on the rest of our buildings, and there comes a point where, again, if I don't have adults there to instruct and supervise kids, I can't have kids at school. I understand this is a very difficult issue. I know there are strong and diverse opinions about COVID and its impact. This is a public health emergency. Please, listen to the credible science about COVID and how to slow the spread. Again, our district's goal is to keep our children in school face-to-face. but that will only be able to happen if we work together in our community. This is a time for leadership. Please take the appropriate steps and do not let this reach crisis levels where it will be necessary to take even more extreme measures. And thank you for your time.
Thank you, Doctor. We have time for 2, possibly 3 more.
Good morning, Commissioners.
Good morning.
My name is Christy Graber. My husband and I moved to Garden City in 2017 to be close to his parents, who were 85 and 87 years old. My husband's family goes way back in Southwest Kansas for generations as farmers and ranchers. And it was important to his parents, who loved their community, to stay here and to age here. And we agreed with them, and we moved back here to take care of them. In moving here, we gave up many amenities, but we were happy to do so, to be close to his parents, who mean the absolute world to us. We quickly became involved in our community. I became involved in many nonprofits, raising money for good causes, like a 3D mammogram machine at St. Catherine's, as well as civic activities. My husband sits on several boards, and we love this community. We love our new neighbors, we've made many new friends, but best of all, we're close to his parents. And then the pandemic hit. Our biggest concern is not ourselves, but our aging parents. We will do anything, and I mean anything, in our power to protect them. While we know our time with them is limited because of their age, normally they are in very good health, and we of course want to protect them from anything that is preventable that could shorten their lifespan or make them ill. Without masks in this community, every day is a gamble. When they stay home to self-protect themselves, while they stay home to self-protect themselves, we can't be there 24/7 because of jobs. We work, we do what we can to protect them, including grocery delivery and running errands for them when possible. But we can't stop others from knocking on their door or walking in their house. Unfortunately, there are people in this town that think it's okay to endanger others. Their refusal to wear a mask around my in-laws threatens our loved ones' health and possibly their lives. Recently, Dad had surgery that we opted to have in Colorado. And we stayed there for several days after his recovery because we felt it was safer, because everyone there was wearing a mask and there was availability at the hospital if something went wrong. And we worried here if there wouldn't be availability at the hospital. But in Kansas, the risks continue to escalate. We are doing everything possible besides sitting on their porch to not let others in to see them who won't wear a mask. Without a mask mandate, that is impossible. You have given this community not only a false sense of entitlement, but the okay to go ahead and endanger others. Somehow this has gotten very politicized, and the rally cry is, they can't live their life in fear. My fear is the people not wearing masks, which is just 85 and 87 years old. They have a right to be protected in their own community. We live by laws every day that are enacted to protect others. Some of them are big laws, some of them are minor laws, but we have them to protect others. This mask mandate would be no different, and it's not a big deal. The numbers are real, the sick are real, the dead are real. The stress and burden on our hospitals and our healthcare workers is real. The stress in trying to protect my in-laws from selfish people is real. This isn't about believing in COVID. COVID isn't Santa Claus. It's not something you believe in. It's real. The numbers and data are real. Masks help prevent spread. I have also been working at the election office since early voting started. I am one of the few people there that wear a mask. I wear a mask because I care about this community. I even went so far as to have myself tested for COVID because I would feel horrible if I was asymptomatic and I was spreading this as people were coming in to vote. I'm encouraged to see many voters in our community wearing masks, but for everyone that's wearing a mask, someone's not wearing a mask. There are many that think they are immune and they scream politics or trite sayings for not wearing them. I have been made fun of sanitizing counters at the polling station, which is ridiculous. The county comes in on the weekends and sanitizes, so what difference does it make if I wipe a counter down daily? This weekend I spoke to one of my neighbors who recently came out of quarantine. She's a young mother with 2 children. She was deeply disturbed that many in our community think it's no big deal and saying that they had mild symptoms. She felt like she was going to die, and it was very difficult. Who's the next is going to be in a respirator? Is it going to be one of you? Is it going to be a wife, a loved one? What if there's no room at the hospital? Where are you going to take them? Where will I take my in-laws? I ask you, please, please don't gamble with their lives. They mean the world to us. We want them here as long as we can have them. Thank you.
Thank you for your comments.
Hi, me again. Zach Worf, we're doing this again. I want to get out of politics so bad. I hate doing this. This isn't fun. I hate coming up and chewing out people that are supposed to be leaders in my community. I could talk about facts for you and science, but you just heard from some of the greatest leaders in this community that have many more letters in front of their name than I will ever have. And none of you have still put on a mask. One of you's a doctor, and you still gotta put your mask on. Even though Dory here, who's just a city worker, she's more than one next to you guys the entire time. It's not because we're afraid. Nobody here is afraid because we got up this morning early after daylight savings to come to this room where we don't have to be. We're not here, we're not doing it because we're afraid. We're doing it because we care. We care about you guys. I don't want to get anybody sick. And I know that if I wear a mask, I reduce that risk of getting people sick because it might save a life. Somebody in this room is carrying a gun right now, hidden, because they think they might get the opportunity to save a life. I watched your commercials for I don't know how long about how many guns you like to shoot and how good you were with them because they help protect people. It's time to protect people by doing what your country has asked you to do. It's wear a mask. Simple. It's not complicated. So we've heard from all these experts this morning, and I'm no expert by any means, but I am a retail worker. I am what you guys have called essential. I like to call it sacrificial. Because we make our end $8 to $10 an hour. Lon, you've never heard of us. We can't afford to go see you, don't worry. There is no reason that you guys can't come into our stores and just wear a mask. But you don't. And we can't ask you to do so. We put signs up and they all say it's required, but we can't ask you to because somebody over last week got stabbed 27 times for asking somebody to wear a mask. A bus driver in New York has been shot in the head because they asked him to wear a mask. Because you guys have gone and made it political. But we have all these scientific experts up here that are saying this isn't political. They probably hold similar political views than you do. Not everybody here is as far left as I am, and I know you guys know that that's who I am. And that's okay. But it's not political anymore. We said a prayer before all of this started, as I'm sure you guys do every meeting. There's no definitive proof that does anything or helps anything, but just in case we do it. So why can we not wear a mask? Maybe we are all wrong and the experts are wrong. And wearing a mask doesn't do anything. It doesn't change anything. Oh no, we wasted a few months wearing a mask for no reason. You're perfectly fine for all your food workers and your retail workers to wear it for 9-10 hours a day. But you guys can't even walk in with enough respect for the people that are doing it for you to do it for them. That's all I'm asking you to do, is make the decision to make everybody care about everybody, whether they want to or not. Because nobody wants to wear this mask. This isn't fun for anybody. Nobody's having a bad blast. But they clearly care a little bit more than you do, and you guys ran to be an elected leader. So lead. freaking leave. This isn't hard.
We have time for exactly one more speaker, and then we'll call a stop to this.
Hi, Donna Gershner, community member. I'm just here to reiterate everything that everybody's been saying. My brother lives in Copeland, Kansas. He has to come up here to do his shopping. He is afraid to do his shopping here because everybody is not wearing masks, regardless of what maybe somebody else has said. Instead, now I have had to order food for him and I go pick it up. And when I'm in the stores, I do notice there are not a lot of people anymore wearing them. Yes, when this first started, they wore them, but now they are not. And it is very scary for me to go into these places knowing that I'm the only one that is protecting them, but they are not protecting me. And that is all I have to say.
Thank you, Donna. No more time to add any additional. We have 3 minutes. We will allow the board to ask any particular question. We will pick our primary discussion in the health department's part of our meeting. Dave, you had a question particular for a doctor?
This Dave Jones for those online. Dr. Dunford, do you mind if I ask you a couple questions since you kind of started off on the mask mandate? Can you, first off, I appreciate your passion, but I have a couple questions. Where do you see the mask mandate applying? Is that under what circumstances? Sure.
So in other counties in Kansas that I've visited that have the mask mandate that's referenced in the study by KU, that applies to all businesses, restaurants, bars. So there's a posting, much like there is here, but it's not being enforced because I don't think anybody has the confidence to enforce it. When you go to a place like Salina, Kansas, those business owners don't let you into their store without a mask. And
well, okay, so you're saying here, what you would like to see is a mask mandate for those of us who go into a store, is that?
Stores, restaurants, bars.
Okay, so then my second question is?
Public spaces.
Okay,
yeah.
I'll buy that. A number of public places I go to have a sign up that says mask required.
Sure.
So I wear a mask in because a mask is required. But I happen to be in a restaurant recently that has mask required, people in there without a mask. So I spoke to the management and said, I'm not comfortable. And he said, we're not the mask police.
Right.
My question to you, who ought to enforce this if we have a mandatory?
It's you.
The police?
The police?
It's a mandate, yeah. I mean, it has to, if it's a mandate, it has to be enforced.
They're the law enforcers.
And that is what's happening because in these other places where it is, in fact, taken seriously as a mandate, people will have their business shut down if they are not following the mandate. That's the rule. So these places, and I understand what you're saying, and I think unfortunately it was brought up that people are afraid to enforce it. I'll add Detroit to the laundry list because I still have colleagues there. People were getting, security was getting shot in the face over being asking someone to wear a mask. People don't have the confidence to do it because no one's gonna back them up. You all aren't going to back them up when they say, County Commissioner, whomever, I can't enforce this in my business, help me.
Well, our sheriff's been a little more reluctant than you might guess on being the mask police.
Mm-hmm.
So I don't know who we turn to. I have not talked to the police department to see if they'd like to take up that enforcement.
Sure. No, that's definitely, I mean, I don't think anybody disagrees with you that it's an additional undertaking and I mean, everybody's busy. Everybody's busy and has a lot to do. There's no doubt about that.
May I say something?
Yeah.
Sure.
I think what I would comment is, if you look at this study that I gave you, it shows the counties in Kansas who have a mask mandate. And I would say as our leaders, that's probably maybe your own homework to look at those counties and see how have they enforced it. Because when we look at counties like Sedgwick County, if you go to Wichita, everywhere you go, someone is wearing a mask in every business. And so they've been successful there. And so that's what I would challenge you guys to do is do a little bit of homework, look at these counties that have a mask mandate that's enforced, and see how they've done it. Because they've been successful, and when you go to these places, people are not complaining about wearing a mask. It's part of life now.
Agree with
We're
that.
gonna call an end to this discussion. It's turning into an argument anyway. So, we're gonna move on. We have a scheduled agenda. We have a very important topic we need to discuss. The gentleman is supposed to be online at 9:15. So you are welcome to stick around as long as you can. Again, we will open this discussion up from the commissioners and the health department. Part of this meeting when we convene is the Board of Health. But for now, we are County Commission, and we are going to visit with Jeff Stevens with our Sparks Grant program update as we have close to $2 million we're going to discuss to approve today. So, Jeff, are you online with us? I see your little name on my screen, but there we are. Good morning, Jeff.
Good morning, Chairman. Sorry, I just needed to find the mute button as fast as I could, or so I could unmute myself.
You have an important update for us for some recommendations for reimbursements. So I'll let you start wherever you want to on this.
Yeah, so we're gonna have a busy couple minutes, talking about some of the different grant numbers here. So we've been able to make significant progress in clearing out, reviewing and getting awards set for all the grants that you have had out there for the community. So this is the Household Emergency Relief Grant, the Agency Operational Relief Grant, the Response and Recovery, and also we're gonna have one reimbursement here down the bottom. Before I get into these grants, what I want to say on an overall basis, Finney County is in a really good spot to respond to some of the changing needs that this pandemic has really generated. Between the health department and what the staff has done, applying for different grants to stretch these Spark dollars further, it's really been a phenomenal effort by your team. And also, I do want to recognize the City of Garden City because they went out and also got a connectivity emergency relief grant. So it's really allowing the dollars within this Spark program to stretch as far as we can get them to go.
Great.
So I think that's a really good thing that everybody should know right off the top. So the first thing that I have for you to consider is there's 7 household emergency relief grants that we've been able to review. There are a number of them within the county. There's over 50, and the program is still open. It's open till November 16th. And while the room is hopefully still full from what I had seen before, I will say that anybody that is really struggling with their finances through this pandemic, is behind on their rent, behind on the utilities, this program is still open and is really designed to meet those concerns that you have, or that those individuals have. Awards can go up to $10,000, and it really is for rent, mortgage assistance, and any of the utility assistance, both in arrears and projecting forward as well for a few months. So the 7 awards that we have recommended for you here is a total of $19,000. As you see, for each one, we've really protected the personally identifiable information of the applicant. So every applicant's been assigned an ID number. So the ID number that's here, we're giving you the household size, we're giving you their income their income level as it relates to the HUD standards. We're giving you what they are going to receive in rent and mortgage assistance. That includes both any arrearages and anything projecting forward. On the project forward, we do an income-based calculation so that if they have no income, they get a full benefit. If they have income, they actually, we do a calculation to only reimburse them for up to 30% of their monthly income, because that's the average for rental income. We assume, hey, if you make $10,000 a year, or $10,000, I'll just say $10,000 a year for good round numbers, you can afford to have $3,000 a month for your rent or your mortgage. If your rent or your mortgage is $4,000 a month, and the $10,000 you make a year is a reflection of assistance, again, this is a calculation of any arrearages, and then the average of 2 months going forward. So this is all based on bills and receipts that the applicant has proven to us that, hey, this information is here, and then the payments will go direct to either the utility provider, the landlord, or the mortgage company. So that's what we have for you today. The average award for here is less than $3,000. So it's really spreading out the dollars, and you'll see some more of these coming to you in the next county meeting as well.
Before you
So any
leave
questions
that,
on that?
yeah, yes, do you have any commissioners for questions on the household emergency? Lon?
Well, Jeff, just for clarification and for the public to know here, what you're asking us to do is make a motion today to approve these payments to these particular families. Is that correct?
That's correct, Commissioner.
And then secondly, and maybe you have this, I know Roxanne's in the room, maybe she has it. What percentage of all the applications would these 7 be? Have we had 50 applications and these are 7 of those, or?
Yeah, so we've had over 50 applications, and these are the first 7 that we have prepared and ready to go, that they've all been validated.
And the others are continuing to be reviewed, and then you mentioned November 16th is the deadline for this particular program, so I'm assuming that they're still coming into Roxanne's office as well.
Correct. There's additional time to go in, get these approved, and then we'll bring back some of those awards to you on the 16th. Some additional kind of recommendations, and then again on the 30th, probably for the balance of them.
And then again, more for public than for us, but remind us, in this particular program, how much did we allocate totally?
You allocated just around $1 million, just north of $1 million.
All right, thank you.
Long ways to go.
Yeah, Dr. Clifford, I have 2 other sheets to give to you all on the household emergency relief. We meet weekly on this, as you know, with Jeff, and although the pot was originally planned to be $1 million, you'll see a number of 570,000 there, and that's based on Jeff's experience in other communities, average requests. We don't think we'll hit that $1 million, and we likely will move that money to other pots. There is due diligence done on this. Jeff's company is very aggressive about seeking receipts and justification, but also there's a county review by Mr. Reese and others, and obviously Roxanne's involved. So I'm prepared to make a motion to approve these first 7 household emergency relief grants.
And I would second that motion, Mr. Chairman.
Any further discussion? All those in favor of approving the household emergency relief grants that are presented, say aye.
Aye.
Opposed?
Motion carried.
Great. So let's move on to the agency operational relief grants. So today we have 6 of them to present to you. There are some additional ones that are in the hopper that we have some outstanding information. We have some questions that are there. And these grants range from, they switch between both working capital and expenditures, kind of reimbursement for expenditures. So in the example of working capital, we use the 2019 tax return of the entity and look at their inventory, their non-owner salaries, their rent, everything else that's reported, and do a calculation based on that for 3 months worth of working capital. There are some additional things here, like you see Turning Point Church, the High Plains Public Radio, that have asked for additional expenditures that are related to their response to COVID-19, and we added those items in as well. So we have a total of 6 awards here for you that we're recommending today for a total of $493,636.30. The only one that I'll call your attention to is Ward's Garden City. That is a maximum award, and we capped that at the maximum of $250,000 for the program, just to ensure that we had dollars
Jeff, Mr. Chairman, again, clarification for our audience and so forth, that application period has ended at the end of October, correct?
That's correct. This application period just ended, so these applications are closed, and these are now available for, we're reviewing everything. We've prioritized those that had, large purchases that they need to do for both the Agency Operational Relief Grant and the Response and Recovery Grant. We prioritized those that had, purchases that they needed to make within, so that they could meet the grant timeline, or those that were at risk for utility shutoffs or, some other adverse action.
And so just for clarification, if I heard you a couple times, you said that you're reviewing some other applications but needing some additional information. If all of those were approved, how many more dollars approximately would we be looking at in this, what would be the maximum exposure, I guess, to this particular fund?
I couldn't tell you for sure, Commissioner, because some of them are working capital awards.
Okay.
So anything I give you, could range from $10,000 to $250,000.
Okay.
So it's really a wide range. So it would just be an honest guess. I do think that we will be under the $2 million that we have allocated for this program.
Okay.
But there are some still big dollar awards that we need to work through.
All right.
And that's actually one thing to make you aware of that's very, very important, is that we do have contingency plans if there is less dollars left over. We've been working with county staff to be able to look at those plans and make sure that the dollars are spent most expeditiously.
That's fair enough. Thank you.
Just before you move on, it occurs to me we have an abnormal amount of visitors with us today. Could you just start off very basically what we're talking about with the Spark recommended reimbursements? What program for the average lay person? Can you briefly explain what we're doing and why you're here?
Great, and it's always fantastic to have that chance to educate everybody. So really the Spark program was the state of Kansas's kind of branded version of the Federal CARES Act coronavirus relief funds. The state of Kansas got about $1.2 billion to help, reimburse those counties, local entities that have been very adversely impacted by the pandemic, but also build capacity for future rounds of what we're going to see in terms of the pandemic. So one of these dollars were really, they were given to Finney County. Finney County got about $10.9 million. And we set up, we did a mix of reimbursements, about $1.6 million worth of reimbursements out to local entities, the school districts, the city of Garden City, to really reimburse for those costs that have already been incurred as it relates to the pandemic. And this included, technology for distance learning, for example, for USD 457. There were some other pieces that some of the other entities had that were not really eligible. Not really funded by another grant program. And these Spark dollars really met the mark there. We also designed 3 grant programs that were off that as well. We did a household emergency relief grant program that was really designed to help those individuals that were really adversely impacted on the household perspective. Be it loss of income, loss of hours that were affected by closures or sickness within their own house, that really caused them to get behind on bills, the utility bills, mortgage, rent payments. We even have a broadband component in there as well. Then we did an agency operational relief grant. And these, the idea of this agency operational relief grant was really to provide working capital to small businesses and also provide working capital to small businesses, and then also provide those expenditures that really improved their ability to respond to the pandemic. For example, Holcomb Recreation Commission is looking for sanitization supplies and disinfectants, and being able to purchase those to go forward. Then the final grant program was Response and Recovery. And this grant program was really trying to be strategic in looking forward and say, how did the pandemic impact us as a county, and how can we close some of those gaps for additional waves that we're experiencing now, whether that's responding to economic conditions or whether that is doing large projects like improving the network infrastructure at the Garden City Community College. That's a great example, and we'll talk about that award in a second. So really that's, we try to approach that comprehensively and really do it holistically as well, because we use the SMART dollars within the county and use other grant programs that were out there, like FEMA Public Assistance, the State Connectivity Emergency Relief Grant, the Kansas Department of Health and Environment, their specific grants, and we tried to leverage all the additional grant opportunities that were out there so that we could make the SPARK dollars go as far as possible as well, and really maximize the capability to Finney County, and really maximize the dollars and the benefit that can come to the citizens and visitors. So really, tremendous amount of effort by everybody involved. When I mentioned right off the top of in my comments of how excellent the staff has done, and the Garden City, if you edit, Garden City's award, the county's Connectivity Emergency Relief Grant Award, the KDHE grant, and what we anticipate coming back from FEMA, you're talking about an additional $3 million that's come into the county that really has allowed us to look at additional things that additional capacity and capabilities that the county can build based off these dollars. So really finding ways to get Finney County prepared for the rest of this pandemic and beyond.
Thank you very much, Jeff. I appreciate that overview. Very, very much appreciate that. I hope that helps explain some questions the audience and the public might have on what we're doing here today. So I'll let you move forward into the response and recovery part of your presentation.
Are we needing to, Mr. Chairman, are we needing to approve those in the agency operational relief grant area? And if so, I would make a motion to approve that $493,636.30 to the 6 award recipients.
Second. Mr. Chairman,
questions, observations?
But in the area of transparency, what we're about to vote on, $493,000, there is one of the 6 recipients or the award recommendation to Turning Point Church of the Nazarene in the amount of not quite $3,000. I happen to be a member of that church, and so in the area of transparency, we're voting on something that I'm a member of. It's out of the 493,000, kind of a small percentage. Anyway,
I'll ask you to abstain. Is that okay?
Well, and I don't have a problem with the asking for the abstention. However, I think it's also in the spirit of transparency important to know that Dave had no a part of figuring out what this award would be.
That's fair enough. Appreciate that.
I can abstain.
I think it'll pass, Dave. All those in favor of the motion? Further discussion, okay?
Matt, clear the back.
Oh, excuse me. Dr. Clifford, while Matt's coming forward.
I think since these are not whitewashed of names, we should point out which entities are receiving grants today. I didn't see it show up on the monitor for the public.
Oh.
I can, if Dory, if you'll allow me to share my screen.
That was my question too.
Oh, okay.
That would be great, Jeff, thank you.
The other question I have is on the large capital, working capital grants to 2 of the entities. Will those expenditures be accomplished this calendar year? And if so, what's the tracking on receipts and the audit trail for that when we're called to task for where we spent the money? Robert, can you answer that about the working capital grants? Will those be expended this year? And number 2, how are we tracking those expenditures?
I'll let Jeff go ahead and answer that, but those are a reimbursement, if you will, on that, as well as some future working capital. Is that correct, Jeff?
Now you're asking me to multitask. we don't have your screen yet, I don't believe, Jeff.
So, Dory, I'm having a really tough time hearing you, Commissioner Clifford. So I think what you just asked was the working capital awards. How do we make sure that they're expended for before the end of the year? Is that correct?
Correct, and how is it tracked?
Okay, so once they are expended, once they are shared to that entity, they are considered expended because it is for working capital.
Thank you.
And we're gonna track, we track the award notification with the staff. So they'll be issued an award letter and everything else. And now you should be able to see my screen as well.
And we do.
Mhm.
Yep, that's good.
And, yeah, Matt, can you see that?
Can you see that back there, Matt?
Somebody read those off and
Maybe we should make a copy.
Well, as the person who made the motion, let me add, Mr. Chairman, if you don't mind, another look, and Salon and Spa is around 6,900. Turning Point Church of the Nazarene is around 2,900 or 3,000. High Plains Public Radio around 140,500. Ward's Garden Center 250,000, as Jeff said, that was the max in this category. The Eagles 12,500, and Holcomb Rec 80,600.
All right. We have a motion and a second. Is there further discussion? Hearing no further discussion, all those in favor say aye.
Aye.
Opposed? Motion carried. Please
it
note,
noted that I abstained.
please note that Dave abstained, Dory. All right, Jeff, you want to just pop our next screen up and go into response and recovery? Thank you.
Great. So, response and recovery, before you today, we have 10 award recommendations for a total of $1,158,142.95. I'll fly through each one of them just to kind of give you an idea. There are some additional awards that unfortunately did not, or additional grant requests that did not meet the state of Kansas's requirements, and we tried to get after them to try and work with the state to find a way, and the state had said no, that it doesn't fall within the grant guidelines, from the overall Spark grant guidelines. So there are a couple other awards that we're still tracking down that may come back to you on the 16th, and there are some that unfortunately will need to issue adverse notifications where they will not be able to receive a response and recovery grant. All right, so total today we have like I said, 10 awards. The first is the Finney County Convention Visitor Bureau, designed to do an advertising campaign focused on bringing individuals back to shopping in the area, and making sure that your businesses can be supported throughout the holiday season. You have the Family Crisis Service Center for upgraded computer equipment to allow their staff to work from home and to be able to support their staff and clients. You have Russell Child Development Center working on a program called Connecting the Dots, enhancing connectivity options for staff and family, and improving their digital learning opportunities and training. TFI Family Services, improving their telehealth support with technology, with tablets to provide therapy, and then also some additional calming materials and personal protective equipment caused by COVID-19. St. Dominic's School, to increase technology availability. This will get them one-to-one with their technology for their students and hire some additional wellness staff. USD 363, this will support the purchase of Wi-Fi installation and technology equipment to improve their digital technology infrastructure within the district, which is great. The Community Health Coalition, Finney County Community Health Coalition, focused on addressing the mental health needs of Finney County first responders and community members. Really, this will run a program for that. Finney County Public Library, which will purchase some additional furniture that are more easily cleaned and remove carpet so that they can improve their sanitization. USD 457 is really, their goal is to provide a second computer monitor. I originally thought this was a monitor, meaning an additional staff member. So it is not, so I just want to make sure that's clear. It's providing an additional physical monitor, computer monitor for their staff so that they can work on dual screens and help with instruction. And then lastly, Garden City Community College, which is a refresh of their network switch to provide vastly enhanced speeds. They had noticed some significant degradation when they had to shut down back in March. This will get them modern and current and really provide support out to the community. That is there are some awards in here that are larger than the maximum that was listed, but as you'll remember, this was a soft cap, and the awards that we're recommending that go over and above are those that I think do meet the set-aside capabilities and the requirements and really the requests of the commission based on what your priorities are.
And Mr. Chairman, two things, Jeff. Again, this deadline was October 31st as well, correct?
Correct. Yeah, this ended at the end of October.
Okay, and then secondly, on the column, the total score, the scoring system, and I'm not asking you to get into the weeds on this, but can you give an example or two of what was scored, why they would maybe have an 85 versus 100 on the scoring?
Absolutely. So we did the scoring system. We did by adherence to the notice of funding announcement, and then so basically, if you had done everything perfectly, but you didn't have one of those set aside categories, your maximum score was an 80. If you had a set aside category, and again, you'll remember the set aside categories were mental health, connectivity, and workforce development. If you met one of those set aside categories, you got potentially additional points as well. So we really scored everything based on that NOFA document that was put out and publicized on the county's website, and that was shared with everybody as they were applying for the grant.
Thank you for that clarification.
Jeff, how much money is left in this area?
So we have about $900,000 that's left in this area. We've got to do some investigation. Like I said, there's still some awards that we're trying to work through with the state to see if we can make them. We already know there was over $1 million that was requested from two different entities to pay down the lease, and unfortunately, the state, when we sought clarification and tried to argue the point, the state said no, that doesn't work for them, and won't work within the grant program. So there are some, there's still a few $100,000 that are sitting out there, and we're trying to figure out a way to get to yes. If not, we can reprogram some of these dollars. I think there are some additional items that are still hanging out there. Like I said previously with some of the contingencies that we can make sure that all the dollars are spent to appropriately.
Mr. Chairman, I would move that in this response and recovery area that we award the 10 or award to the 10 recipients $1,158,142.95.
Clifford seconds.
Okay, further discussion? Hearing none, all in favor of the motion to approve the response and recovery grants presented, say aye.
Aye.
Opposed? Motion is carried.
Okay, and then the last item I have for you to take action on today is one additional reimbursement to the city of Garden City. For everybody's edification, just as a reminder, we did set aside additional dollars that were set from the reimbursement program, and this was to reimburse for the local match for additional federal grants, specifically FEMA public assistance, and then also anything that wasn't covered that some of our entities couldn't get as they were response grant. I think this covers the airport run, which would really improve fiber connectivity out of the airport. And if there was something that was larger in response to COVID-19, having connectivity out there would be phenomenal. And the recommended award here is $231,264.34. This is their local match portion, and I think is really called for to meet this grant.
Mr. Chairman, I'll offer the motion to approve the expenditure of $231,264.34 for reimbursement to the city of Garden City.
I would second that, Mr. Chairman.
Further questions, comments? Hearing none, all in favor of the motion to reimburse the city of Garden City, say aye.
Aye.
Opposed? Motion is carried.
Mr. Chairman, I have a question for Jeff before we leave.
Okay, Larry?
Jeff, you said earlier that you'd have extra funds available. Which one of these areas is most needing and has the most requests built up in that you want to move money to?
So it depends on some of the answers that we can track down with the state. We may turn around and say, the reimbursement may need a little bit more. I'm not. I think I told you all along that some of this, as we get down to some of these awards, is a little bit like nailing Jello to the wall. So right now we're a little bit on that Jello portion. So we should have. I should have a good enough answer for you on the 16th. I think that we may be able to take money that is existing in all three of these programs and use it for county direct aid portion or some reimbursements that we haven't been able to make previously. That's initially what my gut feeling is. There are some additional direct aid pieces that we've learned during this response. I think staff has learned that there are some things that weren't covered under a KDHE grant, or now that we're starting to see a significant amount of disease, they're going to be able to make some adjustments and get some additional things done within the previously approved dollar amount from the reimbursement, from the direct aid plan. That will allow that to go further as well. So depending on where some of those items shake up and what those final decisions are, we'll have a good number for you on the 16th.
Thank you.
And Mr. Chairman, for Jeff or Robert, it's my understanding, and this is more for the people listening and watching, but I believe it's my understanding that any monies that the county does not use out of what it was allocated, which was around $10,900,000, has to be returned if it's not used by the end of this calendar year. Am I correct in that?
That's correct, you are.
So to get the dollars working in Finney County, it behooves us, kind of following up on what Larry's asking, but it behooves us to try to use as many of those dollars as we can.
That's absolutely correct. We don't anticipate sending any money back.
Further comments? Well, I give my hats off in appreciation of local staff, Robert and your people, and Jeff and you and your people. You've done a fantastic job to date. Appreciate it from the commission's point of view. We appreciate this very, very much. Continue the good work, and we will visit with you on the 16th.
And Mr. Chairman, I just wonder if he is ever going to come out and visit with us in person again. Jeff?
Just ignore that one, Jeff.
Deer in the headlights.
He's picking on you, Jeff. Don't worry.
Just picking on you.
Oh, I'm sorry. I'm having a really tough time hearing you, Commissioner.
I just wondered when you were going to come back out and see us in person again.
Well, you don't. I think I'm not allowed to travel outside of the state of New Jersey. I'm pretty locked down here. They're threatening me if I leave.
Thank you, Jeff.
Thank you, Jeff, very much.
Thank you. Have a great day.
All right. Melissa, I'm sure you've been in the audience somewhere patiently waiting. We jumped around you. I apologize, but it's your turn.
Ferris. We bring before you an amendment to change the Finney County zoning regulations in the manufactured home subdivision for permitted structures. We noticed a discrepancy.
Melissa, excuse me just a minute. I just received a message, people out in the land are trying to listen to this online, said they're having difficulty understanding those with masks on. So if you would feel halfway comfortable taking it off there so they can hear you better, I'm sorry to interrupt.
That's okay.
Thanks.
How bold of him. All right.
Well, we're all 6 feet, so I feel okay.
Yes, you are.
Again, I'm here to amend the Finney County zoning regulations regarding manufactured home subdivisions and the permitted structures. Staff noticed a discrepancy in this zoning district regulations with working with property owners to replace existing homes or build new homes. The permitted uses are restrictive and the zoning regulation is inconsistent. Staff proposes changes to provide consistency and flexibility for property owners only in the manufactured home subdivision zoning district. The manufactured home subdivision zoning district are areas in which lots are individually platted. Under section .030118 of the code, it defines manufactured home subdivision as a subdivision where manufactured and modular homes may be located. However, right now, our permitted structure is only single family homes, which does include residential design manufactured homes. This is very frustrating and restrictive for a lot of property owners that live there, considering some of their existing structures and lot sizes don't allow to place a single site home or a residential design manufactured home. We propose changes to the zoning regulations to allow manufactured and modular homes as a permitted use in the manufactured home subdivision district. We've attached the resolution with those changes and the Planning Commission minutes to that case. The Planning Commission did recommend approval of the amendment as presented at the October 15th, 2020 meeting. And the alternatives before you are you may approve the amendment as presented, or you may not approve the amendment as presented, or you may approve the amendment with changes. Staff recommends the County Commission approve the amendment as presented.
And that will be via resolution 26/2020, should you choose to approve that.
Say that again.
26/2020.
Okay.
Dave, you're our representative on that.
I was present when that was discussed, and before that discussion, you couldn't put a mobile home in a mobile home park, essentially. Isn't that about right?
You can put mobile homes in mobile home parks. You can't put a mobile home in a manufactured home subdivision park, which will still stand. However, manufactured homes, which are considered like single wides, on a permanent foundation will be allowed if you approve this change in the manufactured home subdivision.
It cleans up a confusing set of rules that we had. So I would offer a motion to approve her request and the resolution number 26-2020 be adopted.
Dr. Clifford seconds.
Discussion.
Just a point of clarification. The situation that we had brought in front of us, I don't know, a month or two ago, with regard to the homeowner wanting to replace a mobile home, and we didn't permit that, is because that area is not in a manufactured mobile home area, designated area. Am I correct in that understanding?
I believe so. I'd have to review that case to make a definite answer.
Well, because I can see that question, or I haven't had the question, but I can see that question arising. But it was my understanding that that area was not designated for this kind of activity.
Correct.
Okay.
Further discussion? All in favor of the motion to approve resolution 26-2020 signify by saying aye.
Aye.
Aye. Motion is carried. Your next topic.
We are also bringing forth asked to consider and approve a parcel plat for M&C's Farm subdivision. Palmer Land Surveying Services on behalf of property owners Daniel and Rosemary Weckamp is requesting to plat M&C's Farm subdivision. This will be a plat that contains 6.509 acres and will allow for their son to own property. It does have an existing home on the residence, and the property will be used primarily as for residential use. Right now, as it is platted, the property doesn't meet the minimum requirements for lot sizes in the ag zoning district. We have passed these plats in the past with the intention when the property owners go to develop the property, build a home, place any structures on the property, that they will rezone it. And so their potential rezoning is for rural residential zoning districts. So the Planning Commission recommended approval of the plat, contingent to meeting the minimum requirements of subdivision regulations. Staff recommends approval of the plat, and the options before you are you may approve the plat or you may not approve the plat.
I might comment on this one. I'm not particularly familiar with the exact one here, but as an agricultural deal, you have 40 acres, you do not need to go through all this process. However, banks don't want 40 acres, they want 5 or 6.5 acres, and I assume that is what this is about. Keep the bank happy.
The mortgage process,
Okay,
potentially, yeah.
that's what I thought. Further discussion? Do I have a motion to approve?
So
this
moved,
amendment?
Mr. Chairman.
Do we have a number, what do we need to call this
This
door?
is a plat.
Plat.
It's
You're
just a
approving
plat,
the first
okay.
plat?
And I would second the motion.
We have a motion to approve the plat. Signify, all in favor, signify by saying aye. Aye. Opposed? Motion carried.
Great, thank you.
Thank you for your patience, Melissa. As it approaches our normal 10 o'clock break time, we will take a quick 5-minute break. Just a 5-minute. We will resume at 12:03 or 10:03, and then we'll go into Doug's information technology fiber project update. Is that right, Ben? 10:03, not 11:03.
That's
10:03, excuse me, I was in agreement here. 10:03, let's reconvene. I will have Doug Peters come up with his IT, and that will follow with Colleen and the Health Department.
Thank you, guys. This should be fairly quick. We've got about a quarter of the conduit laid in the dirt, and they are progressing every day, so I don't see any issues having it done on time. We do have the BNSF certificate in place, and we only have to get the contractor through his class, and then we'll be certified through BNSF to go under their railway.
So that possibly could be completed as well?
It should be completed by the end of the project, yes. Sarah's got a couple of videos. She's gonna cue one of them up real quick. These are short. This just shows the, one of the streets. So we avoided 5 Points because the underground and the easement there is kind of a mess. So we went east of 5 Points, and then we went back up towards the highway, and this just shows the little section where we went around 5 Points. And then the next video she's gonna play shows some of the section on the highway right there. And you can actually see right there is our easement, and as it gets a little further on, you'll see some of the places where they actually came up above ground.
What's that white stuff?
Right? Snows occasionally here, of course, right when we need it not to. Right there's one of the holes where they got underground there, so you can see they were working in the snow even.
I might interrupt slightly for the public's point. Part of the county's main project is to run fiber optic to the northwest part of the city.
Yes, yes.
You might give a really brief explanation what the overall project is, if you would, please.
Primarily, we're connecting the county buildings with fiber optic. We've only ever had wireless links that anytime there's abnormal weather, the wireless links go down and the health department and EMS lose internet and connectivity. So this project is to connect all of the county buildings with fiber optic for stability and speed.
Thank you.
And this just shows the last little part that they are working on. You can see the guys actually working right there. Any other further questions or comments?
On schedule?
Little bit ahead of schedule, I'm not gonna jinx that.
Is that the end of it right there in front of the
That is
garage?
the end of right there where they was at, and this just shows, you can see one more truck right there out at the end. That's where they're heading through. And
You're on
this
the
is-
Jenny Barker and 156 corner, I assume?
Yep, yep.
Dave?
Doug, how many boring tools, crews are in town?
There should be 2 this week. They were just utilizing 1, and they're already a quarter way done with the boring part of it. So now that they've got 2 of them going, it should be short work to get them all the way down to the end.
Okay, because there's some other folks doing the same type of an operation, so kind of hard to tell who's doing what.
Yeah, there's several people digging holes in Garden City right at the moment. We've only got 2 working for the county.
Okay, thanks.
Okay, anything else for Doug? Thank you very much. John and Roger, we love putting you guys off, so we're gonna do it one more time. And ask Colleen to come up with the health department update, and at this point I would request an adjournment and move into the Board of Health.
I'll offer that motion.
Second.
Been moved and seconded that we move into the Finney County Board of Health. All those in favor say aye.
Aye.
Motion carried. Good morning.
Good morning. So just to start off with, our typical data that I go through, the positivity rates, number tested, how many positive, and then hospitalizations, what we're seeing. So from the week of 10/12, so October 12th through October 16th, we tested 311. 97 of those were positive, gave us the 31% positivity rate. During that week, I took the 7-week data of hospitalizations on the admission numbers to get an average. That week we had 12 average hospitalizations.
Then the week of October 19th through the 23rd, we tested 337, 139 of those were positive, for a 41% positivity rate. Our positivity went up 10% in that week's time. During that same 7-day period, I pulled the hospital average hospitalizations, and it was 13. Over the weekend, we had on Saturday 15 hospitalizations, Sunday 15, today 15 hospitalizations. A new piece of data that I just also am starting to collect is how many ER visits they have for COVID-related or COVID positives, admissions in the ER department, so separate from admissions on the floor. They had 30 COVID-related over the weekend. Another piece of data to give you is we have been tracking the total number of positives that we receive from outside testing sites. So total number of positives in our total community. So if I go back to the last week of September, so it was September 27th through October 3rd. At the health department, we had a total of 48 positives from surrounding county and other testing sites across the state. So citizens that live in Finney County that tested at another site, we received 89 positive results. That gave our county a total number of 137 positives. We are now at, so I'm just looking at a month's time of data. So the last week of October, this is the week that I have my full data on. It's September 18th through the 24th. The health department received 139 positives. The county, 150 for a total of 289. So in a span of 4 weeks, we went from 137 positives in that week to 289 positives in that week's time. It's pretty easy to say that our cases are definitely increasing significantly. I'll also talk to Lon Pishney, actually emailed, and Lon, I'm sorry, I'm going to answer this question today. You asked about how do our positivity rates compare to Johnson or Wyandotte. So if you look at Finney counties, and this is all on covid.ks.gov, if you go to school gating criteria, or school gating metrics, COVID data, you can pull out a list of the county and all the positivity rates. If you look at Finney County, just to go by the rates that KDHE tracks. Finney County, the last 3 weeks, 21% positivity, 31, and now with pending data, it's saying 26. It's the week from 10/25, so they haven't gotten all of the results. Their data is still pending out, but it should show over that 40%. If you pull Johnson's for the last 3 weeks, you have 6%, 7%, and 10%. If you look at Wyandotte, for the last 3 weeks, 8.49%, 9.14%, and then 12.64%. Say we go over to Saline County, has kind of come up several times in today's discussion. Saline County, if you look at that, their last 3 weeks, 7.89, 8.86, 9.48. As you can see, even compared to some of the larger counties, I'll even give you Sedgwick here real quick too, so that you know Sedgwick. 8.96, 13.7, 19.21. So hearing those other counties, hearing the data that you have heard today, our cases are rapidly increasing. But what I would really like to kind of ask as a question is, how do you guys think we are doing as a county with COVID-19? What are you seeing? What do you think of all this information that you have received today? There's been lots of data, lots of facts. But how do you think we're doing?
Obviously, not well.
Question,
Sure.
Colleen. The other counties that you cited,
Sure.
do they have the same testing requirements we do? I mean, the people that are tested just don't walk in, they have to have symptoms. Is that the same thing all the rest of the counties do?
So a lot of the larger counties have asymptomatic testing. They're doing full range, and they're able to do that because they have private clinics and public clinics that are all doing the testing. So the testing criteria looks a little bit different per community. So that would be all specific to that. Any testing that's done through KDHE's lab should be symptomatic only testing. That is the directive from KDHE. However, with a lot of the private industries, they're doing surveillance testing. And I mean, even here locally, we have some entities that are doing surveillance testing. So it's kind of across the board.
So the surveillance testing outside the KDHE requirements, are they reported in these numbers too?
Yes. So now whether or not there's a delay in that reporting, they all are supposed to be reported to the state.
Okay. Where I'm kind of going with this is, it appears to me we're trying to compare things that we're not on the same playing field, it seems like. It seems like the numbers could be skewed by the total amount.
Sure.
And I know I've heard this argument a zillion times in the public, so I thought maybe I'd bring it up. I've got one more question for you. The governor mandated on July 3rd mandatory mask, and we as a county opted out. So for the months of August and September, we were at, discretion, personal discretion, business discretion on how to mandate the mask order. But our numbers didn't change. What all of a sudden happened after 60 days that caused the numbers to change?
I mean, I think a lot of that is general relaxation across our community in precautions. I believe there could be some COVID fatigue kind of going on. People are just tired of hearing about it. They don't have the reminder all over the place of who and when and where and why to wear a mask, to socially distance. I think people are just tired of it.
Let me further explain how disease transmission works. The more people spread it back and forth to each other, it exponentially increases. So if you have ongoing transmission, it continues to build. That's the explanation.
More positive cases can then turn into more positive cases through transmission is definitely an explanation there. I think thinking back on the last 4 weeks, we have had multiple community events that people have attended, large community events that people have attended. You have gatherings. We always saw spikes after Labor Day, if you look at that too. I think that there's a myriad of reasons for the increase in cases. I wouldn't say that there's any particular reason that could be pinpointed for it.
Thank you.
Questions?
Mr. Chairman, I don't know if it's much question as comments. And one thing, Larry, with regard to Johnson County, they were in double digits on their positivity rate. However, the Johnson County Department of Health and Environment is now counting negative retests performed on the same person, and more of those negative tests results in a lower positivity rate. So now they're down into single digits rather than double digits, just because they've changed their testing, the way that they're doing their testing. So it is hard to tell what the truth is. It's hard to get a handle of apples to apples. And then to you, Colleen, just over the weekend, I had a person send me a text, said, in conversation with one of the leaders of the health department a few days ago, inquiring as to why 400 negative tests that Genesis did for college athletes were not showing up. we were told that all the positives from every entity in Finney County as well as Kearney County Hospital are counted. However, that only the negative tests that were administered at the health department are counted. And we expressed this concern and were told it was just too hard to keep the information. My question is, that's what they said they were told by someone in the health department. Is that true?
So that's incorrect information. So all testing in Finney County should be reported to KDHE. The positives are reported to us as well as negatives. Some entities only report the positives to us, but all testing should be reported to the state regardless of the result. With that being said, the positivity rate that we calculate, me personally calculate, I'm taking that off of our data of who we test at the health department. I'm doing that because if you recall all the way back in April, we were one of the only entities doing the testing. So I really wanted to keep my apples to apples here. I'm taking our data as a sample portion of what we're seeing in the community. So I'm taking our full number of total tested at the health department, taking the positives to then do that factor to look at how many of those are coming out positive. The numbers that I reported to you this morning is looking at the total number of positives that we're seeing in the community now that we have other testing sites testing. So far, even when you compare the positivity rate that I am calculating, it is like on par with KDHE, which should be getting total results. We track, yes, the positives. I'm not giving you skewed data of, I'm only reporting to you the positives. Does that make sense? That's why I'm keeping my positivity rate out of just what we're testing, because I get all of the negatives and the positives for the health department.
What concerned me was this was information that they received from someone in the health department, and they didn't provide a name. I don't know who that was.
Sure.
But then you're clarifying, some of this. So we've got.
There's a misunderstanding there for sure.
Yeah.
Yep.
Colleen?
Yes, sir.
I want to go back to a figure you gave us, October 18th through the 24th. You at the health department had 139 positives. And outside testing had 150.
Yes, you said October 18th to the 24th, the health department reported 139. Total county, we had 150 total reported to us for a total of 289.
My question is, out of your 139, through that period of time, how many negatives did you have?
Still, it's gonna run at 41% rate, Dave.
Well, my follow-up question is, out of the 150 positives that came from somewhere else, how many negatives did they have? And I think that's what we're all asking. We don't have that figure, do we?
So negative total number at the health department, we had 197. At Kearney County, I had 52. From St. Catharines, I had 8.
Well, I don't
and then
read
the
it.
rest from there are pretty minimal.
But I think we're missing a few of the negatives that are coming from other testing sites.
Sure, but that is tracked by KDHE and then reported to KDHE for that tracking.
But that
So KDHE looks at overall all testing in the community. I'm looking at what we have tracked since the beginning of our cases from April all the way through, so that we can keep our positivity rate that we've tracked consistent by using the same sample size.
Okay, for the period of time you had 41% positivity rate.
Yes.
From your figures, did the Kansas Department of Health and Environment have the same percentage?
So they currently have on there, this is incomplete data because everything hasn't been reported and then also entered into EpiTrax because that always has a delay. So if you look at Finney for That time they had 10/25 as the reporting date, but they only have 150 tests entered. So it's incomplete at 26%. That may take a couple of weeks to have that complete percentage, but that's why I gave you the last 3 weeks of numbers. Which for the week of 10/11, they had 21%, and then for last week, they had 31%. I had calculated 31% in that exact same time.
This has been my concern, as I've shared with you for a long time. We're dealing with incomplete data, and by the time it becomes complete, it's outdated. So what happened 3 weeks or a month ago doesn't make as much difference as what happened this week.
Sure, but would you say that our trend is increasing or decreasing?
Well, I understand it's increasing, and I have that same concern that you do.
Sure.
But my dilemma is with the mandatory face masks that we're being asked by some, I have more people saying do not go to mandatory face masks than ones wanting them. So it puts us in a bit of a dilemma. But again, I asked the question that I asked earlier, and I don't mean to be argumentative, but if we would mandate face masks, under what circumstances, when I walk out my door, do I have to put on the mask? What kind of rules do we want to apply to that mandate?
Sure.
And then, as I asked earlier, who's going to enforce it? So I think it sounds good to have a mandatory. If everybody wear a face mask, that would be great.
Sure. And I think the point was made earlier, and it's a fantastic point. Other communities have navigated this, and we can look to them for that direction. Other communities have been successful with these mask mandates and have been successful with reducing their transmissions. There are stipulations that we can put around a mask mandate that would help create direction in those types of instances, and I believe that's something. But what my question is, I believe our data shows that we're not successfully combating COVID right now in our community. I believe that's a fair assessment. Our numbers are increasing. Your hospital is strained. We have talked about this for months, that you guys are a data-driven board. We have talked about if hospitalizations increase, ICU conditions increase, if we're having to divert, that's when it's really going to catch the attention. Those things are happening. Our hospital staff was here today to say, hey, we've been overwhelmed. We've had a lot of cases. When you have Sedgwick County, Wyandotte, so Kansas City, Wichita, all diverting, they're all at 100% capacity. Where are we sending our patients when they become too ill to come here? When we're full? Where do we send the patients that are going to have exacerbation of their flu and pneumonia this winter? Where are we going to send them? How many of them are going to decompensate so quickly that they're not going to make it there in time? We're saying that we cannot continue doing this because we are headed in a very bad direction. So I need your support in making some change, doing something different than what we've done in the last 6 months.
I have one more.
Let's share over here first. We have questions on this side. Dave?
Go ahead, Bill.
What would be an acceptable positivity rate in your mind, or it in other jurisdictions? I mean, we can't vote the virus out of the county, so we're going to have to live with a certain percentage of positivity. But any thoughts, guidance?
We need to be looking for, every other county has been shooting for 5% or below. I think that our data, our community has sustained 10 to 15% range a whole lot better than what we are right now. I would like to ideally see at least less than 15%. 15% has proven so far that it's a lot more manageable. Ideally 10% or less would be great, but I can't sit here and say that we're reaching for the stars and we're looking at 41% that can probably quickly turn into 60%.
And we're able to sustain a little higher rate because it's younger people who are being affected, or any thoughts?
I'm not sure. When I look back at our 15%, our hospitalizations were a lot lower at that time. They typically seem to be 10 or below, most often between that 5 to 7 range. It just seemed that we were able to sustain a little bit better. My other issue with saying some of this is COVID-19 is highly unpredictable. We have seen it case and case again that people that you would not expect to be hospitalized and critically ill are, and people that you would aren't. We still don't know enough about this virus to say, you know, we have a good handle on this and we know what to expect. It's still extremely unpredictable.
Colleen,
Yes,
one
sir.
more question. Scott County mandated masks, I can't remember when, but a month or so ago.
August 10th by
Oh, okay.
Dr.
Thank you.
Spotty's.
How is their numbers doing, and how is their hospitalization and things doing up there?
I'm not familiar with their hospitalizations. I would have to check on that. For Scott County, if I give you the same data for the last 3 weeks in the same manner.
Mm-hmm.
So their most recent is showing 5%, but again, it's incomplete. 2 weeks ago, 16.13. 31.65 3 weeks ago, that was October 11th. 10-4, 17.57. I would also,
Now, wait a minute, back up, please.
10-4, October 4th,
Okay.
17.457. But as Dr. Swati also mentioned, you will typically see about 2 weeks for those lasting impacts to actually make a difference in the positivity rate. So you did see going from, oh man, they were all the way up to, at the end of September, 27.91%. If you take that and then look at last week's complete, hopefully data is 16.13%.
It would be interesting to see what their hospitalization is too.
I'm not familiar with that number. I do know that a lot of these smaller rural hospitals are already sending patients here to Finney County. So I wouldn't be surprised if that's also showing up here as well.
Come back to Dave.
Well, I have one quick favor to ask.
Yes, sir.
You, with the help of the medical experts, perhaps could be asked to prepare for us a sort of a little laundry list of what you would like to see in this mask mandate. And with questions that I have in mind, Dr. Carlin just spoke about the 6-7 steps that the school district has adopted. If we go to a county-wide mask mandate, does that do away with their system? Do we suddenly take precedence over that, and so on? So this stuff all needs to be discussed a little bit before any action's considered.
Sure.
Am I making some sense to what I'm suggesting to you?
Sure.
All right, thank you.
Lon?
Commissioner Jones, can I address that? So, just like when the governor had an executive order that applied to masks, we treat any mandate from a local or a state level, we layer that on top of our plan. So that would not negatively impact us in any way. We've done it before with the governor's order, and if the county commission chose to take that action or put into place other restrictions, then we would put those into practice in the school district.
Okay, thank you, Steve.
Yep.
And to that point too, we want to keep kids in schools. That's also a big push to make some sort of difference. We've got to do something differently here in Finney County. We've got to.
I might I've been kind of quiet so far, make a comment or two. First off, everybody should know that the Finney County Commission wholly supports 100% of the guidelines that you have put forth so far. The social distancing, mask, and gatherings, we support that 100%. The issue that seems to come in front of us today is the mandate issue. And I appreciate Mrs. Robbins, her comments that the folks in the public that are wearing masks are going to wear a mask, and the ones that aren't going to wear a mask are not going to. So I think that the word mandate is causing a problem. Each of us commissioners have received, I would guess probably 30 emails in the last week, probably running about 65, 40, 35 against mask. At least mine have been. So the mask mandate thing is where the hang up is, the word mandate. Again, we support 100% of the guidelines. It is kind of where I'm at. I do have kind of a medical question. My understanding, viruses are rather small little creatures. Do the mask you're wearing right now, is it qualified to filter out such a minute
There have
virus?
been multiple studies that have proved the reduction of droplet spray and droplets with the use of masks. N95s are the best. The second best is surgical masks, such as what I'm wearing right now.
But
Duke University also published that.
But it's droplets, not the virus molecule itself.
Sure, so the virus is transmitted in those droplets, yes.
Again, we're having a problem with the word mandate. I see Commissioner Pishney has asked permission earlier to, he's prepared some information. I will grant him.
I appreciate that, and I asked the chairman to not put me on the clock today as he normally does. And
I'm going to do it anyway.
Oh. But I do have one question before I get into my comments and a question or two. But when it was brought up about Scott County, if Scott, and I'm just using this as an example, but you said the hospitalizations are about 15 now. I think the highest they've been is 17, and then I saw them at 12 Friday or Thursday or sometime and so forth. So you said average 13 or thereabouts. So in that average of hospitalizations at St. Catherine, if Scott County sends someone here from their county, is that included in that hospitalization count?
It's total number of hospitalizations here at this hospital,
Right.
no matter what county they're from.
So that kind of leads me into my comments, because you used the words or the phrase data driven. I'm having trouble being data driven because I don't know what the data is. I'm having trouble with the truthfulness and the accuracy of data. And I say that from a standpoint that there's been reference to a KU study. Well, there was a KU researcher who did a study, provided it to KDHE, and KDHE used that to bolster their position on the use of masks. However, another organization came in and dissected that data and found that from June 29th to October 19th, there was a rise in cases by 582% in counties that used the mandate mask, and in non-mandated counties, the rise was only 260% during that same period of time. Secondly, prior to that, KDHE used a couple of different charts and put them on two different axes to bolster their support for mandated masks. And another organization came in, dissected all that information, and found out they were not using one axis. They were using two axes. So I get just a little emotional and raise my voice just a little bit, and this is not to you, this is to KDHE. But how can I trust KDHE's information? Because it has proven that it's not accurate, it's not truthful. So with that being said, Mr. Chairman, I want to read some of my comments. And in the last few days, not only was I contacted by email and text, but I was contacted in person, contacted by messaging, and probably over 30 contacts, and only 4 of those were asking for the mask mandate. The others were all asking that it be recommended, that it not be a mandate. And so these people who are demanding the masks, of the ones that I received, they said, do the right thing. Well, the right thing probably differs from my definition of the right thing. I interpret their definition of doing the right thing is as do what I'm asking you to do. My definition of the right thing is based on my interpretation of biblical principles and values. My definition may not align with an individual's personal desires for this specific matter or other cases. Based on biblical references, I do not believe it is the role of any government to mandate what its citizens or residents should do with their bodies, if it is not a criminal activity. In Scripture, we're taught the purpose of government is to punish evil and reward those who do good. Anything government does outside of this is outside of government's God-given jurisdiction, I believe. The foundation of our country is based on Christian principles and values. And the most important principle is to love God, the creator of the universe and the truth. And second most important principle is to love our neighbor as ourselves. Whether this current pandemic is a result of God judging us to get our attention for our sinful and destructive behavior, or it is simply another result of a fallen or broken world in which we live, and that was caused by the actions of our original parents, Adam and Eve. Either way, we must search our hearts and repent so that we can live under God's blessing. I say this because this virus is not a mask issue. We must be respectful of people who choose to wear masks. However, we also must be respectful of those who choose not to wear masks. In my opinion, this virus is a health issue, but not just a physical health issue. It affects mental, emotional, and spiritual health. It is posing serious negative effects to our immune systems. It is causing more abuse with both children and adults, those incidents, and more suicide attempts. It is causing disharmony within families, and it's causing financial distress for both families and businesses. This virus is a lives versus lives matter, and to quote one of the people who contacted me in the last few days, a mask is a Band-Aid on an axe. It has been stated that my mask protects you, your mask protects me. I've heard that I don't know how many times. First of all, I question whether or not masks provide adequate protection of anyone versus creating harm to our immune systems long term. However, if the statement is true, why do I see so many drivers within Finney County with no visible passengers in the vehicle who are wearing their mask? It appears that they're doing so either out of fear or for their own protection. There's been so many double standards and mixed messages through this whole process of the last 8 months. Masks don't work, then masks do work. Can't be transmitted over a surface. It can be transferred through surface. If masks are worn by school kids, why can't we have masks for families who want to go into the nursing home or the hospital to see their loved ones? If masks work. We need to have a right to choose when it comes to our body, except for criminal activity. And finally, in our country's history, I've never known before in our history of a time where we've quarantined healthy people. We have quarantined sick people before. We have quarantined because of certain diseases, but I've never seen before where we quarantine healthy people, and that's what this virus has caused us to do. So, Mr. Chairman, I appreciate you for allowing me a little latitude this morning. I would want to finish with this. Our U.S. Surgeon General stated in July, you can increase your risk of getting the virus by wearing a mask if you are not a healthcare provider. That's the Surgeon General saying that. My health concerns associated with wearing masks include reduced oxygen levels, and anecdotally, and we had several anecdotal information given to us today. I am personally aware of 2 people who fainted in stores because they were wearing a mask and were not getting enough oxygen, and just recently one who fainted in church. due to wearing a mask extended period. Carbon dioxide toxicity, moisture retention in the lungs, increased facial touching, and more effort to breathe, as well as facial rashes. So there's other things related to the mask that are more longer term and going into the future that I don't think we think about too often. But again, and I've said this over the weeks and months that this has taken place, I still believe we're doing harm to our immune system. And again, out of the 30-some that I had, only 4 were asking it, up until this morning, up until these comments this morning, we're asking us to mandate masks. So, yes, and I was gonna ask the question too, and I'm glad somebody did. Is it 0 or 5%, 10%, on positivity rate? Because someday we've got to say, this virus is here and it's going to be here for a long time, but I don't think we're ever going to get to a 0 number. So I was glad to hear you give some numbers or some approximates. So thank you, Mr. Chairman. I appreciate the latitude you provided me.
I have a couple of questions. So one point to make, Lon, and Commissioner Krishny.
I'm Lon. I'm okay with
you're Lon.
that. Yeah, I'm okay with that.
One point I would like to make is I think that you can find data to support whatever agenda that you perceive out there.
And that's
right?
part of my point.
One of the things that I would like to point out is, do you trust your medical providers here in Finney County? Your health staff, your health department staff, me as health department director, the hospital CEO coming to tell you today, we cannot continue doing this way. Do you trust us to give you that legitimate data to tell you what we really are seeing here on the front lines? And do you value that data?
Well, first of all, I respect each and every person who's working on this, whether I disagree with them or whether other people disagree with them on their opinions and so forth. I am still not sure, Colleen, and I say this with all due respect, I am still not sure that our local data is the accurate data that we need to be making these kind of decisions. Secondly, and I know that it's going to be reactionary no matter when and how we do this, because it's a virus that, well, I started to say snuck up on us, it really didn't. It hit us, right in the face. But just as soon as we do something, we're reacting to it, and tomorrow, the positivity, and I'm just throwing out a number here, the positivity rate's back down in the 20s. So I get concerned too about what do we do with reactions that we might be 2 days later finding that that's not necessary to do that. So I get pretty careful about what I'm going to vote for, what I'm going to support. But yes, I respect the people. Quite honestly, I don't know that I trust all the data. And I'm not pointing fingers at you or anyone else.
Sure.
I don't know, like I tried to illustrate with my comments, and you're absolutely on point. We can make that data do anything we want it to do. As an accountant friend of mine told me years ago, you tell me what you want to justify and I'll do the numbers to justify it. Talking to an accountant over here. But, so, that was my point about the KDHE stuff. It's been refuted. So, yes, I respect the people. I don't know that I trust the data. And finally, this doesn't address your question. I am a freedom and liberty person, especially when it comes to our own bodies. And I think we're intruding on that when we start mandating.
Dr. Clifford.
When we started this process back in the spring, considering shutdowns and things, I think we had 3 things in mind, or 3 goals. One was to slow the spread of the virus or achieve a certain low positivity rate. We also didn't want to overwhelm the hospital resources, their personnel, their facilities, the ICU, and we wanted to limit deaths. And I remember stating those criteria. And I feel that we are, in the last month, have failed to achieve those. And I agree with your assessment on that, Colleen, and what others have described here this morning. We county commissioners have limited tools, some more draconian than others. We've discussed masks, but we could put travel restrictions on citizens both in and out, quarantine restrictions if you go to certain places or you're from certain places. We could close businesses that we identify for various reasons. We could limit gatherings by number, as you've mentioned. So, and there probably are others. To me, I find the mask, as Lon's little metaphor of the Band-Aid on the axe, it certainly reminds you that the axe is sharp. And to me, we can debate the benefit of masks, and I live in masks that do benefit me, not this one necessarily. But I think it's certainly a reminder to people when they see people in masks of what we are all in, which is a pandemic. I find a mask order unenforceable. I don't feel we need to ask our sheriff and police to enforce it, but that it may come to that. But I would like to prevent shutdowns of business, and I vote with my feet. If I see a business not protecting me through social distancing, masks, cleanliness, I don't go there. And I won't name the restaurants I will not go back to because of the circumstances. So it frightens me from an economic standpoint that we might, a week from today, close or put schools on homeschooling, kids on homeschooling, because the parents will have to be home in many cases. So that will have a huge impact on our economy, like it or not. So yes, the kids are less vulnerable to this disease. I feel strongly about that as a physician, having seen the data, but we will force their parents to be home with them. And that will have a huge effect on our economy. So personally, I don't like waiting on things. And for purpose of discussion, I'm going to present a motion for Kinney County-wide a mask mandate in public settings. I won't try to parse what that is or when that is. And I would ask that we reevaluate that every 2 weeks, next time even 16, based on the data that you provide with the goal, and I will say a 20% or lower positivity rate because of all the fudge in the data. So, Mr. Chairman, that is my motion.
Can that be restated, Bill? Is it tough to?
I'm moving the Kinney County Commission institute a mask mandate in all public places for a period of 2 weeks, beginning tomorrow, to be reevaluated on the 16th or every 2 weeks for renewal. And with the main criteria for us would be that our positivity rate be below 20%.
Is a motion on the floor?
I'll second it, just so we can have discussion.
Been moved and seconded. Discussion.
Go ahead, Larry.
Question on the 20% level, Bill. When was the last, Colleen, when was the last time we were below 20%?
Let me pull that up. The week of September 28th through October 2nd.
Before that, but going clear back through July and August, we were below 20?
Yep.
Okay.
Further discussion?
Yes, I'd just like to say, again, I feel this is unenforceable. I wouldn't ask law enforcement to enforce this, but I certainly would ask businesses to do so if they want my business. And I'm creating, for want of a better word, possibly a headline or a signal to the citizens that whether we proceed on this or not today, we're serious. And I don't think behaviorally our citizens have social distanced, maintained, minimize their own risks. So I would like to send that signal to the citizens of Finney County that we as a commission are serious about this. We are going to be data driven, and we want them to comply to protect themselves and others. Thank you.
Mr. Chairman, I have a question for Commissioner Clifford. You said you see this as implicating public places. There's where I'm having trouble. What's a public place? Is being out on the street? Is it in a building? Is this needs some definition before we.
It's certainly not your own property, and it's anywhere where you can't maintain social distancing, even incidentally from other citizens. So in your own car, I would not expect you to have a mask on. Walking in a public park, I wouldn't expect you to have a mask on. But certainly if you're in a quick shop, I would expect you to have a mask on.
But I'll give you a hypothetical. I go to the restaurant, and it's one that I need to wear a mask in to be seated, but then I can take the mask off under their protocol to have my meal, obviously. Are you saying that restaurant can't allow me to take my mask off because it's a public place? That's why I'm saying we've got such a foggy issue here, it's tough to vote for it.
I am trying to send a signal to the public to protect
I understand,
themselves.
I appreciate that.
If I may give you some information here. So I have an example mask mandate from Wyandotte County. When in public indoor spaces, including workplace, business, place of worship, or public facilities such as a community center or library, individuals are required to wear a mask covering the nose and mouth. Masks should be positioned carefully over the mouth and nose and should not be touched or readjusted. So there's some explanatory here. So masks are not required inside a solitary enclosed workspace such as an office. Masks may be removed in restaurants and bars when individuals are actively eating or drinking, but must be worn at all times otherwise. When in public outdoor space or when using public transportation, taxis, or ride-sharing services, individuals are required to wear a mask covering the nose and mouth. This includes bus stops, sidewalks, parks, playgrounds, farmers markets, and restaurant, bar, patio seating. Masks are not required when the individuals are driving alone or with others they live with, when individuals are exercising alone or with others they live with, or when individuals can absolutely guarantee that they will not or they will be able to maintain a 6 feet of social distancing from others. The following individuals are exempt from the requirement to wear a face covering: those who are deaf or hard of hearing, children younger than 5 years old, children who are younger than 2 years old should never wear face coverings because face coverings due to the risk of suffocation. Children who are 2, 3, or 4 years old with the assistance and close supervision of an adult are strongly recommended to wear a face covering at all times in settings such as grocery stores or pharmacies where it is likely that a distance of at least 6 feet cannot be maintained from non-household members and vulnerable people must go. Persons with medical conditions, mental health condition, or disability that prevents wearing a face mask. This includes, but is not limited to, persons with medical conditions for whom wearing
wearing a face covering could obstruct breathing, or who are unconscious, incapacitated, or otherwise unable to remove a face covering without assistance. And then it just has some explanation of what face coverings provide a higher level of protection. And then children in child care facilities in K through 12 public schools may use face shields as an alternative to a cloth covering if authorized pursuant to an order of the governor. So those are some general stipulations from an example in Wyandotte County.
And I can provide you with the Saline County one. Actually, it started as Salina City, and then Saline County also voted for it. It's similar.
Dory, do you need to leave the meeting?
I will need to go soon.
Do you have somebody who can take your place? No. Robert? Okay. I'll excuse our clerk for election issues. Robert, you're going to have to take over her duties, please. Lon.
Well, will obviously be voting against this particular motion on the basis of freedom and liberty issues that have been raised by the majority of the people who have contacted me. But I also, I monitor more than positivity rate. I monitor hospitalizations and death. And Bill, you're right. Initially you said there were going to be 20 deaths, and you were right on with that prediction. I think you maybe thought it was going to happen sooner than it did, but it did. However, last week there were 3 funerals here in town. One was Parkinson's, one was a mental and physical illness of an elderly, and then one was a 33-year-old who hit a slick spot in the road going to work and died in a single car accident. Death is all around us. That's a part of life. Am I insensitive to that? Absolutely not. I'm sad anytime I hear about a death, whether it be a youngster or whether it be someone in their 90s, like my uncle who died a few weeks ago who was 95. So I'm sensitive to that. The hospitalizations, as I just indicated a minute ago, concerns me just simply because if that's including, say, a person from another county, that's not giving us a true reading on Finney County as far as who's being hospitalized. And I have a very good friend who's currently in the hospital with COVID, oxygen issue. And that person, I texted him the other day and asked him how he's doing. I said, by the way, are you in favor of mandated masks? And he said, absolutely not. And this is somebody who's in the hospital with COVID. So I still get back to the freedom and liberty thing, and I think we need to educate, we need to encourage, we need to tell people to be courteous of others. It's the thinking of others instead of thinking of myself. When I'm a distance away from somebody or where I go in to do business. And then lastly, personal choice. And you've indicated it with restaurants. I have a choice. I can go into that place. I don't have to go into that place. Somebody else had mentioned they had a choice to go to Colorado for the surgery and so forth. We have choices. And I don't want to intrude on those choices, especially when it comes to our individual bodies.
I agree.
Further discussion?
Can I just make a comment about the hospitalizations? Because you have a point, Juan, definitely. I mean, but we are a referral center out in Southwest Kansas. So if you don't want to count people that are coming from counties that don't have higher levels of care within the walls of their institution, that's fine. But also recognize that we have patients who need services like ECMO, which is extracorporeal oxygenation, basically, which we don't do here, et cetera. And some COVID patients actually need that. And so we also are sending patients from our institution to, even get a higher level of care. So I can see how you think those numbers are skewed, but also we are the ICU for the region. So I think it does matter that hospital beds are being taken up by, not taken up, but needing to be utilized by individuals in the region that are not just from Finney County, because that strains our hospitals still.
And ultimately, those rooms aren't available for Finney County citizens if they need to use them.
And Mr. Chairman, I respect that, and I respect what you said, Gretchen. However, that doesn't give us a true reading as a Board of County Commissioners, as a Board of Health, on how it's affecting Finney County residents. Now, it's affecting the hospital and the number of beds and so forth and so on. I get that. It's affecting the hospital as far as somebody needing to be transported somewhere. But as far as mandating masks, as far as what's the health within our county, that needs to be dissected. That's what I'm saying. I'm having trouble with the data because it's not telling us the entire story.
Sure, so the number of cases and the 8 deaths in the last month aren't part of that story either?
Yes and no, but as I just illustrated, there were 3 deaths last week that were not COVID related.
Sure.
I mean, there was a statistic here a while back, and this is a total US one, that 230-some thousand deaths per week throughout the country. And let me pull my note up real quick. Through the first 3 quarters, that would be through September, not October, the total US deaths were about the same per month as the total US deaths in each of the preceding years, 2019, 18, and 17. So when we try to keep it in perspective, and am I sad about a death due to COVID? Yes, I'm just as sad about the death due to the car wreck. I'm sad about any death. And throughout the US, the deaths have been fairly much the same per week with COVID and without COVID. So that's where I'm coming from, if that helps you understand me just a little bit better.
I'm going to start to draw this discussion to an end. Further comment would be, even regardless which way this vote goes this morning, I would highly encourage the community as a whole to revamp our efforts of social distancing. I would encourage businesses who choose to do so to mandate masks for their particular business. Administrator Reese has that option to do that with county buildings, and it's my belief that he will enforce that. Would you make a comment, Robert, please?
Well, we do have, obviously, some of the buildings that are, do have a mask wearing requirement on it. We're looking at doing that in the remainder of them.
So what you've just heard is he's going to mandate masks in the public buildings, and I think that's a great idea. I would encourage all businesses. But I think in my mind it is that business's choice. I've had a couple of business owners tell me that they would refuse to honor a mask mandate if that went countywide. So this is not an easy solution. Whichever the vote goes, somebody's not going to be happy. It's just a safety, it's a guarantee. So at this point in time.
Point of order, Mr. Chairman. I lost my place in the meeting, and we are now as County Board of Health.
We are the County Board of Health.
If this were to pass, are we advising the County Commission to have this, or are we just as a Board of Health to promulgate this?
Sir, you're above my pay grade.
Any thoughts,
Robert?
No, you'll be acting as the Board of Health to initiate a mask ordinance.
So we are in the appropriate setting for this motion. All those in favor of the motion?
Aye.
Opposed?
Aye.
Nay.
Nay. Can I make a comment on my nay vote? Is I'm afraid if we mandate it, what we're going to do is increase fear and animosity amongst our citizens. And I don't want to pour more gas on the fire. It seems like we have enough animosity amongst us, just through this political election that's going on. And hopefully after tomorrow, it will idle down a little bit. But I don't believe, Colleen, this is the one issue that's gonna solve the problem. You know, I think there's so many things out there that we don't understand about this virus, that just wearing a mask, and I have no problem wearing them. I wear them when I have to go into a certain, store or something. I don't have a problem. I can't see out of my glasses most of the time because they fog up, but I will wear them. Thank you for your work.
Motion was defeated. And they do tend to knock hearing aids off too, I guarantee you that.
The last thing that I would ask, from you as local Board of Health is, where would you like us to focus our efforts? We
Social
cannot-
gatherings,
Okay,
I think we need to highly encourage to knock off the large gatherings and
sure.
it
So
seems like to me that
recommendations.
is where the bulk of this is coming from. Maybe I'm wrong, but
So would you be interested in then looking at a mass gathering limit? Or a mandate or ordinance along those lines? Or are we saying we're gonna continue recommending these precautions that haven't worked for the last 6 months?
gentlemen, mass gathering issue, totally new issue.
Well, Mr. Chairman, I don't know that, I think you're being a little bit too harsh when you say it hasn't worked. Because I would disagree with that. Yeah, we've seen a little spike here in the last month. I get that, and I'm not naive enough to think that we haven't had. But as far as the mass gatherings, I think again, it's if we hear that there is going to be a mass gathering, that we get to the leaders of that mass gathering and we say social distancing and mask wearing and so forth is how we're going to curb this. I think that's appropriate. But I don't think we start shutting down life, to try to curb this thing, because as I said, just as soon as we start doing that, maybe tomorrow, we see a significant drop. So, but I wouldn't say that we haven't been managing this issue over the last several months. Yes, there's been a spike in the last 35 days, whatever that's been.
So what I'm hearing, and please correct me if this is wrong, Lon, you are stating that you are somewhat open to a mass gathering. Is it requirement?
Well, I guess what I'm trying to say, and I didn't make myself clear, so
Sure.
Thank you for raising that point. I don't think we should say it has a limit of 10 or a limit of 25. Because what setting is it in? Is it all outdoors? If it is, that's a good thing, because one of the things that as I've done my research, one of the common themes about COVID patients is a lack of vitamin D. That's sunshine. So if they're outside, as long as they're distancing, as long as they're being courteous to the other people, what matters if it's 10 or 25. So I was trying to, and I didn't do it very well. I was trying to speak to your comment about limits. I'm having difficulty with limits and requiring those kind of things. But being cautious, being careful, absolutely. And that, I'm just one of 5.
Sure.
I'm just one of 5.
No, I was just trying to understand a little bit more. So I guess really what I was trying to ask is at least capacity limits.
Depends what it is, yeah.
Things along the lines of, we've had several community events that have had or brought in large numbers that have not been able to distance because of capacity numbers and such. And so I believe that if we continue to allow that recommendation, that we may not be successful in that recommendation, because people will often just do 100% capacity.
But, Mr. Chairman, a point of clarification too.
Sure.
If I understand, maybe not anything you said here this morning, but if I understand through your reporting and so forth, we haven't seen this rise come from clusters. Have we?
I will say that most often
now the report is that people don't know where they got it from. They don't know who near them has had COVID-19, who is positive. They don't know. Or at least they're not divulging that information. That's alarming, right? It's alarming in the sense of you don't know where some people are getting it from. Could it be workplace? Sure. But that's everywhere right now. So who's to say where that is actually originating from? But we do know a set of standards and precautions that do help reduce that transmission. And so I guess I'm trying to find out that clarity of where would you like us to focus on our efforts? Because you've heard from the hospital now, you've heard from us, you've heard from school district, we can't maintain where we're going. And so I'm asking for direction on where can we focus our efforts to help reduce transmission in our community, and we desperately need your support to make that happen.
Mr. Chairman, just a quick, will you take any additional questions from, or comments from the audience?
Yes, it has been brought to my attention, and our administrator had a fantastic idea, and it will happen this week. The mayor and I will get together, and we will make a recorded public statement, hopefully quite soon, and it will be put, I assume, on both websites and made available to the public for our support of these type of measures that you suggest. If you have certain ones you want us to highlight when we make this public video or recording, it would be very informative or helpful. But perhaps that will help the community with the mayor and myself speaking out in a recorded version of how we can help this pandemic to at least maintain.
And Chairman, along those lines, it'd be important to note that we have also been discussing a COVID-19 task force so that we can align our communication and our efforts in the same direction to help reduce transmission and increase education and a platform.
I think that's the point of the mayor's and my maybe try to get some more vocal support of what we need to do as a community with kind of maybe been lacking. But am I on the right track?
No, you're correct. You're correct. It's just an effort, in essence, by potentially both local units of government here, and we can engage school districts and so forth to make those public announcements.
Again, like I've said many times, we totally support all the measures you put in place. Maybe we just need to stress it more in a public setting, and hopefully this would be one step towards that. Just for train of thought.
Will you take any, there's one in the audience that would like to make another comment. I mean, it's up to you.
Let's put 5 more minutes on this beast and then lay it to rest for the day.
Betsy, you had her hand up.
Like I said, I work
Microphone, please, so we can public can hear. I assume there's 2 or 3 on Facebook yet.
So like I say, I work at the hospital, and every day there's updates on COVID. It lets us aware of what's happening or whatever. I would recommend, as part of your public whatever, to maybe the health department let the public know, you know, there's more cases, this is what's happening. So it makes the public aware that we need to be more careful. Such and such school is having an outbreak. Please, public, let's be a little more careful. Just public awareness. I know what's happening, and so I always tell my friends, be careful. It's an uptick. Don't go, public places or whatever. That's something that gives the people a choice to react. Makes them more educated of what they need to do. I would just encourage you to maybe let the health department do a public something, a couple of times a week, and let us know. So we can make our choices better.
Okay, thank you. Let's move on, guys.
So, Mr. Chairman, do we need a motion to go back?
Yes, we do.
Okay. and I would move that we reconvene as county commission.
Second.
All those in favor of reconvening signify by saying aye.
Aye.
Aye. Motion carried. Lon, jot that down.
Good night, everybody.
Lon, will you jot the motion and second?
Bill will second.
Right there.
I've been texting the combine people. So, all right, let's move this forward. If Roger's still around, he is. Thank you for your patience, sir.
Thank you. I'm glad I'm not a patient.
Patience.
Oh.
Patience.
That's how rumors get started.
As you know, we put out bids for a vehicle for emergency management. We sent them to all the local dealers as well as the state contract, and we sent one to Shawnee Mission for a bid. After it was all boiled down, you have the numbers in front of you, I presume.
Nope.
Burtis Motors 35316.
Oh, you don't?
Not that page, but
Oh.
we've seen them.
Okay.
Scroll down. Who's operating the computer?
I'm sorry.
Now, this is a 3/4 ton, correct?
Burtis is 35,316. State contract is listed, and Shawnee Mission came in at 33,193. The Shawnee Mission and the Burtis motor vehicles were comparable. The state contract vehicle did not meet the towing requirements that I wanted on this vehicle. With all that said, this would be paid from Sparks, from what I understand.
That's correct.
That's correct.
That's correct.
I would recommend the Burtis Motor purchase of 35,316 to the board.
Dave?
I have a quick couple of questions for you or Steve. Is this to tow your command trailer, Steve?
Well, yeah, right now it is, but it's also, you know, we disseminate large quantities of PPE, and it's not real conducive to the vehicle we have now. And plus, if we have to bridge and partner with the fire department or law enforcement, we've got that capability to deploy off-road. And really, the vehicle we use now is really not, it's not really equipped to be an acute response vehicle. It's more of a support type vehicle. So we're just trying to enhance our response capabilities.
I understand
The
that.
vehicle I have now, I wouldn't be safe to pull.
Well, you have a Jeep, right?
Yes, sir.
So, and you have one employee. However, Sparks has a time limit on it, so you gotta order a vehicle before you have that. But is this vehicle gonna be used as a daily driver by an emergency management employee?
We've had discussion about reassigning that Jeep vehicle to another department that's in need of transportation and replacing that capability with this vehicle.
Okay, all right, thanks.
With that question comes because about 4 years ago, I threw a hissy when I found out the sheriff put 50,000 miles on the emergency management's pickup, and I made John buy the darn thing.
Yeah.
So,
I think Public Works got ripped on that deal.
so if you're going to call it an emergency management vehicle, use it.
Yeah, I'll make sure I got the key.
Well, Mr. Chairman, as I've stated in this meeting a number of times before, and I stated to Robert last week, I appreciate low bids, but I have taken the position over my years on boards of best bids. And in this particular case, I think the best bid is the Burtis Motor bid because they're local taxpayers, they're people who are gonna give us the service if we need it immediately, and not that they wouldn't service a vehicle that's bought from out of town, but I'm just thinking that $2,000 to me is not enough difference to take a low bid over a local vendor. So I would move that we accept the Burtis bid, and that's the 35,316. Am I correct on that number?
Question. would you rather have one that you can carry more people with you, or just?
That'd be a question for Steve.
That'd be a question for Steve. We originally.
That's a good point.
Not necessarily, we've got some contingencies to run, to try to enhance our response capabilities with some of the Sparks initiative.
Okay.
So, there's gonna be opportunity there, we feel pretty certain that we can, handle that extra manning or things of that nature.
And this-
Command support, things like that.
When this vehicle bid originally went out, it went out as a crew cab.
Crew cab.
Shawnee submitted a super cab, so we gave Burtis the right to try to match that same vehicle. I think the difference, the crew cab came in at $37,103.
Yeah.
But Burtis was the only one that bid on that because of the way things worked out. And also just for the board, I know everybody's in a hurry to get out of here, but I think your local chamber uses 3 times for local, if something's spent in the community, they use that 3 times variable. I think it's either 2.5 or 3 times, so any dollar spent in the community circulates that much more. Dollar spent out of the community doesn't come back.
Well, I'll second Lon's motion.
Because what I'm hearing Steve say is super cab is just fine. I can't see Steve, but.
Yes.
Yeah, okay, thank you. Okay. So-
Further discussion? All those in favor of Burtis Motors?
Aye.
Aye. Motion carried. Were you logging motions in seconds?
Oh.
Okay.
You got that?
Yes.
Okay, cause I've got it written down for one motion here, I'll relate to you.
Thank you, Roger.
Thank you, gentlemen.
Thanks, Roger.
John? We're gonna need a map, cause I have a little bit of trouble following which road we're getting rid of here.
Well, there's a whole bunch of
Well,
roads.
this is Friends.
Which one?
Friend.
They're all together.
It's about half a friend.
Yeah, well, yes, I gave you 2 maps for sure, or at least the map with the shaded areas of what's being asked to vacate.
Next one up.
No,
The other way up.
right, no.
No, that's
Right below that.
2 more. That one, there you go. So that one shows, highlights property owners and then the roads and alleys in between asking to be vacated. Pretty much everything hashed south of Kansas Avenue is what is being asked to vacate.
Where's the elevator set?
To the right on Niket and Railroad Street.
Okay, there's the railroads.
Some of that that's being, the vacating is being sought. City County Commission Districts all offer the motion to accept the petition.
Second.
That's in my district.
Does that mean you will be representing
I would
at the
either do that.
hearing?
I'd do that.
Okay. All those in favor of accepting the petition signify by saying aye.
Aye.
Aye. Motion carried.
Set a viewing date and let me know.
Yeah, it needs to be advertised for 2 weeks, 2 times, and no more than 10 days before the viewing day. So, however,
You're,
to do anything else.
Oh, you're still sticking with that date?
Yeah, I think I'm overcommitting myself.
All right.
One more meeting after this?
One more meeting, sir.
Oh, dang.
So, right, we're done with that.
Right, access road.
And there may be some more coming later. There's a few pieces there on the top street, north of Kansas that might come later depending on how things work out, I guess. Right?
somehow our technology is not keeping up with the technology here. On our monitors, we don't have.
I'm sorry, which one?
I'm not sure which, if you're looking at.
We're,
They see what you see up here.
Okay.
So I don't, you need to tell me which one you are
Well,
referencing so I can move to that.
Okay. Now we're on the next memo for the road, yeah.
This one here?
Unless you have more questions about the vacation.
Well, that already passed.
Okay. So, this piece of go down to the picture, one more. Oh,
Just need to, yeah.
there we go.
There you
I'm
go.
like,
No, there
that's
you
not
go.
what I got. Okay, so that piece of property highlighted in blue is being, they wanna start or put trucks on there and have a shop. Their access there is at the red circle, is the only access they have to their property. KDOT, for safety reasons, is hesitant about improving them, letting them improve it, or improve a new entrance somewhere else along that frontage. And the request came to me as, what do we think about frontage road or access road not off of 50, but off of farmland, to get access to the property. And so I just threw a couple red lines on the piece of paper on there just to show what kind of options we may have. When that request came, it was also mentioned that maybe some corridor management monies be used to help offset cost or help, for us and maybe the landowner just to get them access. Since then, I don't know, and Ron Hall's here, he may be able to discuss that a little bit, or he will be able to explain a little bit better, but, I think some of the corridor management funds are being committed through 2022. So they may not be as available as what we once thought they would be.
Mr. Chairman, I'd like to ask that we start the discussion with the landowner's comments first. He is here and been here all morning, because he came to my house the other evening and visited with it and what his intent is and so forth. And then once we've heard what he bought the land for and what he's trying to do with it, then that we hear from Ron Hall with regard to the issues of the highway, and if you don't mind.
That's fine. Good idea.
So, and I can't even remember how to pronounce your name, but he gave it to Dory earlier today, and he's lives in our neighborhood and so forth. But just tell them, how you came to buy the land and what your thoughts are with regard to the land, first of all.
Hello.
Good morning.
My name is Otero Salazar, and I'm by that land to try to put a business, bring more work. I have a semis, and I sell it because I have a problems. I have a loss on money, so I sell it. But that land I buy to try to put a truck stop. I'm living here for 6 years, my home, but on my semi I live in 5 years, bring cattle to Hong Kong, and I see that land and I like it to put a truck stop to buy the name of Pilot or Flying J, and I'm trying to put 2 inters, but KDOT don't approve it. So that's why I'm thinking to make a garage, not a shop, because it's industrial, that land. So I'm going to build a garage to put all my tools. And my inter is too small, but
¿Qué quieres decir? Que no te están entendiendo.
okay. Él me preguntó que para qué lo había comprado, ¿eh? Digo, pues para poner un truck.
He bought this land because his idea was to put a truck stop. My name is Eddie Diaz, sorry about that. But they wanna close down that entrance. What's gonna happen after that? ¿Qué quieres que no te corten abajo?
Pues yo por mí yo quiero mi entrada que a mí me dejaron, a mí no quiero que me afecten más en las entradas.
Well, the main thing is he was gonna try to do a truck stop. That's not gonna be feasible. Then he's wanting to do a shop for his trucks. He already has a couple of trucks parked clear down, be the bottom of that picture down in the south part of that right now. And one thing let them. Yeah.
First of all, we need light there.
Yeah,
We got robbed last night.
but they took stuff off their semis last night and because there's no security, no lights, no lighting. But it's my understanding that you would be willing to help with the road or something. Tell me what you told me the other night as far as that red line down at the south end, coming to Farmland Road. Did you say you would be willing to help with some of that road or not, or?
Okay, que si ellos quieren hacerme la entrada
Por la Farmland Road.
sí, por la Farmland, está bien.
This road here.
He's
Está
further
bien.
to the south, I think it's the
No voy a
north,
pagar,
isn't it?
de ahí nada.
Hmm?
Pero bien.
No,
Das el
east
pero
to west.
quieres hacerlas
Isn't
si
this
las hasta el día.
on the north side of the highway?
No, es este.
No, this is south side of highway, Farmland Road and the highway. This is the service, this one piece here with the blue building up in the upper right corner is the Service Master building, and a repair shop.
And what's this down here?
That's the pallet company, over here, on farmland
Oh, okay.
in the highway.
John?
And then there's usually food trucks there and stuff.
We have a translator here.
Okay.
Well,
If you wanna.
yeah, he's translating for him and so forth. I think we're okay. Yeah, thank you though, appreciate that.
So they close that down on his land. What happens to the people down there? They got an entrance as well, right before the water canal.
See, the ditch is over on the right hand side.
Right there by.
That's the drainage ditch. And there's a little bit of a road that comes between the drainage ditch, where John's red line is, that goes out to the highway. There's a little road that goes on past Service Master to those two other little buildings that you see, to the right side, by the ditch. And that's what he's talking about, is it would then take them off of the highway, and get them to Farmland Road as well. So, I think we've got other property owners, is what I'm trying to say, that could be benefited if a road went to farmland. But as I explained to him the other night when he came to the house, and Ron Hall and I talked about this too, is what we said last time is the cost of putting a road in is one thing, the cost of maintenance for years to come is a whole nother thing. And so we've got that as well. But I wanted you to hear from him, from the owner of the land, what he's trying to do is some trucks. And would you be willing to help pay for some of that road, or able to pay for some of that road, or not, or?
No, yo no voy a pagar nada, yo.
Puedes ayudar a mantenerlo, que es el caso tuyo.
Pero pues no estoy haciendo los cambios.
He's not willing to pay for that.
Yeah, well,
Because they're gonna chop some of his land.
right.
He doesn't want that.
But he would donate the land for the road or not?
He don't want to.
Okay.
Well, if it comes down to it, he's gonna have to, cause if they shut that down on top,
Yeah,
all these people on the right side of the screen, how are they gonna get in?
yeah,
If they're gonna if he wants to shut down that, where the paint shop's at, then everybody's gonna have to use farmland.
mm-hmm.
And then the top, I don't know what that top line, I don't know what he's chopping there.
Well, this line is
Yeah.
one that our engineer just put in there as a possibility. But I think Ron Hall will come up here and say that's not a real good possibility because of how
No one has said anything about closing that. That one's there, and we're not talking about touching that. What we have is on the property line between the pallet plant and their property is a field entrance. And they're wanting to upgrade that to a commercial type access. And due to the proximity of that to farmland and the fact that we're looking at a 4-lane expressway highway, we are not interested in doing that and adding another conflict point. If we were to put in an access off of the highway or allow one, we would want to move it farther to the east, and it would only be right in, right out, which then creates another set of issues. So the option that we were hoping for is potentially that they would be able to utilize either Farmland Road or the east commercial entrance that's already in existence as an access point. And as John alluded, we put this on the program thinking about using some corridor management funds to get into that. Well, then after we were on your agenda, I talked with our corridor management manager and found out that those funds are obligated through most of 2022 already. So we may need to find some other way, because I don't think we'll have that time to allow that.
Let me ask a question, Mr. Chairman. Up there along the highway, and let me digress just for a second. I suggested to Ron the other day that one possibility might be to use that Service Master exit that's already there, and refine that road, if you will. But that's really not a feasible thing when you've got semis and they're going by a repair shop and they're going by Service Master and so forth and so on. What I didn't think about until just now, Ron, and maybe even John, until I saw this with the red line there along the highway. And I don't know what the rules and regs are, but what if that Service Master entrance was closed and part of that red line made a little bit of a frontage road and repositioned that entrance, not created another entrance, but you replaced the one that's already there, you close off the field road entrance, and you made another one and made it accessible to Service Master and the other people that are being served by that road along the ditch right now.
Put it on the.
You'd have a lesser,
on the
you'd have
property.
less distance, for road, but if you close this one, you close the field entrance, but you somehow made a frontage road and had, say, an entrance here, or entrance here, or an entrance here.
Yeah, probably on the property line. is what we
In
would do.
somewhere, and then they're served by this. Would that be something, and would I mean, I understand what you're saying about the year for corridor funds, but would KDOT be able to help with something like that?
We would consider that entrance. Normally, in these circumstances, we don't get involved. As far as the funding, it's the developers to fund. But I think we would look at combining the two entrances, shifting it. Now it's obviously another property owner. Don't know what their thoughts would be.
I understand, but I hadn't even thought of that until I saw that red line on there now.
If you put it right on the property line, Ron, is there, there's no way to turn off with the westbound, there's a divider there, isn't it?
No, there's not a divider. It's just paint.
At that point,
Oh,
it's
okay.
painted. There's a divider up a little.
So it
ways
wouldn't have
closer.
to be necessarily a right-on, right-off.
If we combine and with that other existing entrance, we
Yeah.
leave that as an entrance, a full entrance.
Well, that makes a lot more sense to me.
Adding one in would be right in, right out.
Cause you'd have, if you do it on the east end of the property, on the property line, so both owners would have to give up the property for the entrance. But it would sure save on a lot of maintenance.
On the north side, right?
Yeah.
Yes.
But if you close,
It's a lot of heavy traffic for a very congested area, guys.
Well, you're gonna have a lot of that around the county everywhere.
Yeah. Well, that's part of our concern is with the project coming on farmland, we're gonna have a lot of the wind blades and things
Big
turning
traffic
out
there
of there.
too.
We don't wanna add another obstacle or another entrance collision potential point.
Are you asking for approval today, or is this still in the,
We're just, I want
Informational
to get your
stage.
thoughts. Like I said, it was the idea of a frontage road to provide access. I don't know that there's any need for a
Okay.
Second.
All in favor?
Aye.
Motion carried.
And then, Robert, way back
action taken. Reports, Robert?
Yes, we continue on with, obviously, as you saw today from Jeff, all the various grants and grants reporting that we have going on. We are within 60 days of the suspense tape on the agreements, or the grants, so things will continue at this pace or a little bit faster as we continue on, just to give you a heads up. I did place within your packet, you have a copy of the county's purchasing policy and so forth, and in that, on some of this stuff, we can work expeditiously if you allow us to, by foregoing, quite possibly some of the, county's current bidding policies in that regards, and trying to get a lot of this thing.
Allows you to make emergency purchases of.
Correct, and it's, if I remember correctly, it's actually at the bottom of your purchasing policy, the last paragraph, if I remember correctly, and which, the last section anyway, which allows, with the board's approval to, forego the county's purchasing policy, as long as we don't, make any infractions against the state's requirements for purchases and so forth, so this allows us to move a little bit quicker, to get some of the things that were on that listing for the Sparks grant and some of the changes that's taken place on the fiber grant. So that would, if you're in favor of that, that would take a formal motion by the board to authorize that for this purpose.
Just a clarification, adding this section to the purchasing policy,
No,
or just
this is your purchasing
Right.
policy. So
So-
in essence, you're invoking that authority to do it in this situation.
And I would so move, Mr. Chairman.
Second.
I want to make sure I understood. I want to make sure I understood.
Okay, further discussion, everybody clear? All those in favor say aye.
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 Thank you, sir. Additionally then, we do have a reporting requirement on the 10th of this month for the Sparks grant, and on the 5th of this month is on the connectivity grant, which I'll be finishing up this week. The one on the 10th, you'll see some adjustments made to the, well, in essence, Jeff is working on the reporting aspect of that for those 3 programs, and then your direct spend program. Recall in the direct spend program, some of the things that we had in there initially that was approved in August by the state of Kansas will be moved out of there because of the fact that we received other grants for that. So you'll see those types of changes go on within that document, but it will go out prior to you seeing that again. I just want to give you a heads up on those changes coming about in that regard. And then remember that he spoke a little bit about pushing those monies into those other programs as needed, so you'll see the result of that. So in essence, it's like a budget adjustment, quite simply, if you will.
So what you need from us then is, since that reporting date is due before we meet again as a commission.
That's correct. Just
you would
authorizing
like
those-
approval
those
to
types of changes.
change those and
And your,
Submit the
originally
report.
approved.
Submit the report with changes.
correct.
Yeah.
So move.
Your turn.
Second.
All those in favor of approval to submit the corrected report, signify
Aye.
saying aye.
Aye.
Aye. Motion carried.
Very good. We should have the, award letters, if we don't have them later on today, should have them for you by the morning. The ones that you approved.
Right,
today.
Dory told me that she didn't have them yet, that she would contact me and I would be in early some morning.
Yep.
As soon as she'd let me know that I would be in early and sign those
Absolutely.
letters. The letters of, that did not meet the qualifications, the I'm sorry letters, will those be available to be
Yes.
signed as well?
Yes, those will be available as well, but you also heard that, Jeff is still continually trying to
Correct.
look
There's
at
several more in the works.
opportunities to maybe try and, figure out a way that we can on some of those.
Okay.
It's hard, work in process.
Yeah, it'll be working for a while yet too.
Thank you.
It?
That concludes it for me.
Okay, Larry?
Real quick, joint city-county meeting, Holcomb, after the meeting, had a requested meeting with the, Holcomb city manager. She has some real concerns with the, our, sheriff's department. Empirical groundbreaking, and then, I had lots of phone calls and lots of emails.
Lots of phone calls, lots of emails as well. Thank you for the honored gentleman of the Golden Shovel at the groundbreaking. Appreciate that, and it was a great day for Finney County, Garden City. There's a sales tax oversight committee meeting at 2 o'clock, and I am not gonna be there. I have the packet with the information if any of you guys are willing to take my steed. I'm sure, Robert, you're planning on being there. but-
You've been there before, have you not?
Yeah.
You know what you're doing, I don't.
2 o'clock.
I'll go view the road closing in Friend.
At the back of the book is the staple together today's paperwork and time and location.
And this over at Matt's joint.
Didn't even look to see where it is. Robert, do you know where it is today? At the very back, stapled together one.
Don't know, but
You got too many pages. It's all stapled together. People until you get the, there you go. Administrative.
Yep.
And that's it for me. Dave.
Real quick, had a library board meeting and as usual, the joint meeting, city, county, city. Had a Finney County Committee on Aging meeting. It was typical, the empirical groundbreaking. And then one kind of unique thing, the American Legion National Commander was in town, and some of us had an invitation to enjoy the lunch courtesy of the American Legion. Couple phone calls, including our state senator, John Dole, wanting to know at that time what was going on with the face masks. The rumor was that the governor was going to require face mask mandates before certain monies came through for testing equipment and so on. That turned out not quite to be accurate, but that was the size of my contacts.
Well, as far as attending things, the American Legion and the joint meeting, my comment about the joint meeting with the others is I was really happy to see several people from Holcomb. In the past, we've had trouble getting attendance from there, and I thought that was very beneficial, especially when we were talking about the fireworks subject and so forth, so I thought that was good. The other two things, I did attend an economic development meeting in Dodge City that was for the region. It's we got the booklet last meeting. I think it was laying at our desk from Wichita State, and it was their presenters that were giving pieces of that. And then we had a KAC board meeting Friday, and we had a regular board meeting a week ago, and then another board meeting. It was called to renew the executive director's contract, which we did for the calendar year of 2021, and a couple of other things. But during that last board meeting, one thing that was said, and I can't remember what county he represents, and he's an emergency management person, but he said that they got a call at their county from the lieutenant governor who said that they're going to make the rounds and go to every county and try to urge them to mandate masks. And also that they said that for the contract tracing assistance that they've been giving counties, that they're pulling back on that. And his take is that that's their way to instead of having a mask mandate, they're pulling back some of the services and so forth, making the counties be more dependent on the state. So I'm a little concerned about what I heard him say, but I expect a call from the Lieutenant Governor or someone maybe coming out to Finney County sometime in the near future.
Okay. Is that it, gentlemen?
Lon's mentioning the fireworks. Some of these days we need to get that on the agenda.
Agreed.
The folks ordering fireworks order those months ahead of the 4th of July.
And we need those people in front of us at that meeting.
I agree.
Great. Adjourn.
See what the fireworks are tomorrow.